7 healthy habits para sa healthy Pilipinas.
Pag-ibig ang panalo, one love, isang uri, papugay at papuri, walang talo sa pagpapasuri. Practice safe sex para sa pamilya at minamahal.
Kalusugan ay unahin at mamanahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado mapitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas.
Todo care for yourself, care for others. Stressed sa work? Kailangan mo ng time out? Rest muna. Take a break. Maraming paraan para makapag-relax. Mag-beach o mag-hiking, movie night o sound trip, yoga o zumba, kumanta o tumugtog, mag-gardening o mag-baking, mag-sports o magpamassage, mag-video games o magbasa. The list goes on, mga ka-healthy peeps. Ano man ang trip mo, mahalagang maglaan ng panahon para sa sarili. Mag-recharge, mag-recover. Follow us for more tips and updates at i-achieve na ang 7 healthy habits para sa healthy Pilipinas. Paalala mula sa Department of Health.
What if you and I had a dream school? Ano kaya yun? Would it have dinosaurs like experiments? Little things that become big. What if we can suddenly see invisible things? Would it have a giant heart or a big, big brain? Or flies into outer space? May sagot sa ating mga tanong, pero
Join us as we explore Mind School, the coolest space for science and art ideas.
Step into amazing portals with us, where extraordinary, weird, and mind-blowing connections
Come to life! Inhale. Exhale. Inhale. Exhale. Uy! Nagulat naman ako sa inyo. Matagal na ba kayo dyan? Mukhang may bago kang kasama, Mikey ah.
Hi, Manong G. You know, we felt calm na rin looking at you guys so relaxed. This is Mario. Mind mover din siya tulad namin ni Fisher. And sasama siya sa adventures natin dito.
Hi, Manong G! So happy to be here po.
Uy, Fisher? Kala ko ba you're taking a break? Gulat ako, nandito ka rin.
Hi, Mikey and Mario! Yeah, nagbakasyon muna ako to be with my family. Sobrang stress na kasi ako kasi 4 years ko na silang hindi nakita. Eto, tumawag lang ako kay Manong G para mangamusta. And timing, they were doing calming exercises. Kaya sumali na ako virtually.
Were you taking a short nap, Manong G?
Hindi. Ito ay isang breathing exercise. Natutunan ko to sa friend ko. At tinuturo ko kay na Simon at Kyra. Mga anak nga pala sila ng mga kaibigan ko na gustong bumisita dito sa Mind School. Simon and Kyra, kilala mo na si Mikey at saka si Fisher, di ba?
Opo, I've been following all the Mind School adventures from the start. Hi, Ate Mikey! Hi, Kuya Fisher! All of your adventures have been so much fun, so it's really exciting to finally meet you both.
Me too. I'm a really big fan of Mind School. Really happy to be here.
Welcome to Mind School, Simon and Kyra. Get ready for lots of mind-blowingly cool adventures. And I'm happy that Mario is joining you too. O sige, sign off muna ako. See you real soon. Bye!
Hi, Simon and Kyra. Very happy to meet you here. This is your Kuya Mario.
Hello Simon, hello Kyra.
Hi! Actually, matagal na po namin gusto bumisita dito. And kanina, nakaikot na po kami ng onte. Medyo natanggal nga po yung stress namin ni Simon eh.
Hello, Kuya Mario. Hello, Ate Mikey. Mukhang masaya dito sa Mind School. Walang stress. Di katulad sa bahay at sa school.
Great to have you here, Simon and Kyra. Welcome kayo dito sa Mind School parate. Pero, alam nyo ba na normal lang ang stress?
Normal lang pong maging stressed.
Oo naman. Kasi sa buhay, hindi talaga maiiwasan ang mga problema. And because we have to deal with many problems, stress helps us to deal with those.
So, we should always welcome stress, Manong G?
Hindi.
I'm so confused, Manong G. Okay lang ba ma-stress or hindi?
And lahat po ba ng stress ay masama?
Para hindi kayo masyadong ma-stress, thinking about stress, how about we tackle stress as our adventure for today?
Gusto namin yan, Manong G. Siguro kayo rin naiintriga kung ang stress ba ay kaibigan o kaaway.
Sa adventure natin ngayon, alamin natin, lahat ba ng stress ay masama?
Giant Brain, I have a question. What happens to our brains when we're stressed?
Wow! Nandito pala yung mind ng Mindy School?
Wow! Grabe! Ang laki ng brain!
Not exactly, Mario. This is a special place where we can explain what happens to the human brain when we experience something like stress.
And, oh wow! You can really see inside!
Kuya Mario, can I also see it? Wow! Kita nga lahat dito! Grabe! Pero, Giant Brain, I have a question. What happens to our brains when we're stressed?
Let's go straight to the answer, Giant Brain.
Ikaw ba ay nakararanas ng stress? Kapag ang isang tao ay stress, naglalabas ang katawan ng cortisol o stress hormone. Ito ang nagbibigay sa atin ng dagdag na energy para ihanda ang sarili na harapin ang problema o sitwasyon.
Oh, so pag tumatawid pala tayo or may emergency, natural lang na may cortisol?
Oo, Mario. Kasi cortisol helps your body cope with emergencies. Pero may iba pa ring stresses sa iba pang mga bagay na nakakabahala sa atin.
Kasama po ba dyan yung pag-stressed ako, thinking kung papasa ako sa mga classes ko? My brain also releases cortisol?
Yes, kasi cortisol makes you more aware. And kailangan mo maging aware para maisipan mo ng mga tamang solusyon ang mga bagay na yan.
How about po when I really want to join a basketball team and bago pa lang ako and every time I try, parang ayaw pa rin nila ako isali.
Yes, cortisol din yan.
Okay naman pala itong cortisol na to for us. So, why are we so worried about stress?
Oo nga, Giant Brain. If stress is normal, pwede bang baliwalay na lang natin ang stress na nararamdaman natin?
Normal na ikaw ay makaramdam ng stress. Pero kung madalas ang pagtaas ng cortisol levels mo o chronic na ang stress, ito ay may negatibong epekto sa iyo.
Pag palagi palang mataas ang stress at cortisol levels, hindi pala yun mabuti para sa atin. Bad news pala yun.
Tama. Pag ganyan na, problema na ang stress kasi masama na ang epekto sa'yo. Madami ang pwedeng maging negatibong epekto pag sobrang taas ng level ng stress mo.
So, Giant Brain, ano ba ang mga negatibong epekto ng mataas at madalas na stress? Like ako, ang dami ko pa kasing chores sa bahay, aalagain ko pa yung kapatid ko, and ang dami ko pang test sa school.
Wait, Giant Brain. I also have a question. What will happen to my brain pag stressed ako dahil mga kaibigan ko gusto ako sumama sa gimmick, pero ayaw naman ako payagan ng parents ko?
Ako naman, kapag meron akong gustong i-open up sa mom ko, pero hindi ako sigurado kung paano niya tatanggapin o kung maintindihan niya ba ako. Hindi ako makahanap ng tamang chance, kaya nasistress ako. Giant Brain, what does my brain experience kapag ganun?
I also have a friend na teenager pa lang, nagtatrabaho na. At ang boss niya, sinisigawan siya sa maliliit na bagay na mali niya.
Ako naman, I know of a kid who gets bullied a lot in school. Lagi siyang pinagtatawanan kasi yung shoes niya daw masyadong malaki o kaya yung bag na gamit niya pamalengke na bag.
Grabe. Oh, I also asked some of my friends, ano ba yung top things na nakaka-stress sa kanila? And ito yung sabi nila.
Nai-stress ako kapag sunod-sunod ang utos sa akin dito sa bahay, lalo na't may iba pa akong ginagawa.
Minsan nakaka-stress yung mga ibang requirements na feeling ko hindi naman kailangan, katulad ng pag-video ng mga sayaw sa physical education or PT.
Pinagkaka-stressan ko dealing with relationships, friendships, or with my significant other, or even my family.
So right now, it's meeting academic deadlines and also thinking about job opportunities after college.
Nai-stress ako sa mga groupmates kong pabigat at ghoster. Yung tipo magpapakita lang sila if may deadline at meron pa yung ipapasa nila. Parang hindi mga college, no?
Ang nagpapastress para sa akin ay ang pag-manage ng aking time at pagsasabay ng school projects, exams, at extracurricular activities. Lalo na't ngayon lang kami nag-face-to-face at meron pa rin COVID.
So the things that stress me out right now mostly revolve around school, applying to the colleges I want to get into, and also submitting my homeworks on time.
Ang pinaka nakaka-stress sa akin ay ang pag-iisip ko anong career ang gusto kong gawin habang buhay at ang pagkakaroon ng responsibilidad bilang teenager na magdesisyon para sa aking kinabukasan.
Isa sa mga bagay na malakas makapagpa-stress sa akin lately is when hindi ko nasusunod yung mga nasa calendar of activities ko. Because in that way, nafe-feel ko na I'm very unproductive.
Wow! Buti na lang marunong mag-handle si Giant Brain ng marami niyong questions. So, Giant Brain, anong nangyayari sa katawan pag mataas lagi ang stress levels?
Kapag ikaw ay stress, tumataas ang cholesterol at blood pressure level mo. Baka atakihin ka sa puso. Pwede din malagas ang iyong buhok, mag-dry ang balat mo, magka-acne breakout ka, magka-joint at muscle pains o sumakit ang tiyan. Yan ang epekto kapag madalas ka ma-stress. Ang iyong immunity sa sakit ay bumababa din. Kapag stressed ka, pwede ka maging sakitin o matagal bago gumaling.
Oh no! Na-stress akong malaman ng effects ng sobrang stress. Huwag ka masyadong mag-alala, Mario. Kasi, pag aware ka na ngayon na yan ang nagagawa ng stress sa katawan mo, maiiba na rin ang pananaw at kilos mo.
Uy, wait! Sa katawan pa lang yan. Napansin ko na kapag stressed ako ng matagal, nag-iiba na rin yung moods ko. Giant Brain, may epekto din ba ang stress sa emotions at ugali natin?
Masama rin ang epekto ng stress sa ating emosyon at pag-uugali. Mapapansin ang pagiging bugnutin, malungkot, depressed, balisa, masungit o hirap sa pagtulog.
Sabi ko na nga ba, malaki ang epekto ng stress sa emotions natin. Kaya nag-iiba din ang moods natin. Eh pag ganun, bad vibes nga magiging signal natin sa mga kasama natin.
Oo nga. Kaya pala pag stressed ako sa grades, nasa-stress ko din pala yung family ko and lalo na yung friends ko. Kasi nga, hindi ayos ang emotions ko. So, paiba-iba rin yung moods ko. So, affected yung relationships ko with my family and friends.
Stress affects me and everyone around me pala. Pwede rin ako magkasakit pag patuloy-tuloy mataas ang stress levels ko.
Buti na lang, dito sa Mindy School, nandyan lagi si Giant Brain na pwede nating tanungin tungkol sa mga brains natin.
At hindi nasi-stress si Giant Brain kahit na ang dami nating tinatanong.
So kung normal at hindi naman pala natin may iwasan ng stress, ano dapat ang attitude natin palagi?
That's right, Kuya Mario. If everything is stressful in school and at home, especially for teenagers like Kyra and I, what can we do?
Care for yourself, care for others. Mahalaga na aware tayo sa ating mga nararamdaman para malaman natin ang mga triggers nito. Maging in control sa emotions mo. Gamitin ang mga mood tracking tools na ito para mas lalong maintindihan ang emotions mo. 1. Mood journal. 2. I-download ang Lusog Isip app. Ang emotions at feelings ay bahagi ng mental health. Ugalian itong bantayan at pahalagahan.
Hey, Giant Brain! We have one last question. If we cannot get rid of stress, what should be our attitude towards stress?
Ano nakikita mo?
Mikey, tingnan mo. Tingnan mo.
Hi! Thank you, Giant Brain, for showing us what happens to our brains when we're stressed. Ngayon, mas naiintindihan ko na talaga ang stress. Parati natin sinasabi ang stress sa everyday conversations natin. Pero ngayon, gets na gets ko na talaga siya.
Oo nga, I really thought that all stresses are bad. And that some people are just unlucky to have stress. And that some people don't have stress at all.
Oo nga, Simon, no? Normal lang pala talaga ang stress. Kaya dapat, alam natin kung anong gagawin natin pag stress tayo.
Alam nyo naman dito sa Mind School, meron laging special na lugar para maintindihan ang iba't ibang mga bagay. At ang stress ay isang bagay na sa tingin ko ay napaka-importanteng maintindihan ng lahat, kahit ano pang edad nila.
Manong G, tingnan mo si Mario. Sinusunod yung example niyo.
Mabuti naman. Baka stress lang siya lately.
Ay, sorry. Nadala ko dun sa breathing in, breathing out. Yung ginawa mo kanina, Manong G. Hey, Giant Brain. We have one last question. If we cannot get rid of stress, what should be our attitude towards stress?
Ang stress ay normal. Ang mahalaga ay conscious ka kapag ito ay nakasasama na sa iyong kalusugan. Dapat matutunan mo kung paano mamamanage ang stress.
Oh, so the first thing to do pala is to be aware when you're stressed so you can manage it.
Ibig sabihin, pansinin mo ang sarili mo kapag stressed ka.
Ang mental health ay mahalaga sa ating pangkabuuan at individual na abilidad magtrabaho, mag-isip, makaramdam at mabuhay. Kaya naman ngayong panahon ng pandemya, huwag kalimutang pangalagaan ang ating mental health tulad ng pag-aalaga natin sa ating physical health. Ang self-care ay isa sa pinakamabisang paraan upang pangalagaan ang ating mental health. Ang simpleng pag-exercise o pagtutok sa ating mga hobbies ay isang paraan ng self-care. Care for yourself. Bigyang oras ang sarili at mga bagay na nagbibigay sa'yo ng saya. Nagkakaroon ka na rin ba ng Zoom fatigue dahil sa meetings o di kaya ay sa online class? Huwag kalimutang magpahinga. Importanteng maglaan ng break at ipahinga ang utak. Maglaro muna ng paboritong games. Malaking tulong ang breathing exercises sa pagpapakalma at para maibsan ang ating pakiramdam. Matuto ring mag-set ng boundaries para sa iyong work-life balance. Matutong irespeto ang work boundaries ng iyong mga katrabaho. Dahil sa pandemya ang ating kinakaharap, hindi mapigilan na tayo ay mapalayo sa ating mga mahal sa buhay. Ngunit hindi dapat maging hadlang ang distansya upang tayo ay mag-hashtag care for others. Nakumusta mo na ba sina lolo at lola this week? How about sina mama at papa? Mga kapatid, kaklase? Kung hindi pa, ang isang simpleng kumusta sa pamamagitan ng video or voice calls o text messages ay tiyak na makatutulong sa kanilang mental well-being. Care for others, ang isang malakas na support system ay nakakatulong rin sa pagpapabuti ng ating mental health. Kung ikaw o sino man sa iyong kakilala ang nangangailangan na makipag-usap sa isang mental health professional, tumawag lamang sa mga numerong ito mula sa National Center for Mental Health. Ito ay libre lamang at kahit sino ay pwedeng tumawag. Ngayong panahon ng pandemya, hindi biro ang pinagdadaanan mo, kaya naman make sure to care for yourself and care for others para sa isang healthy Pilipinas.
Important pala talaga na pansinin ang sarili pag stress. Narealize ko ngayon, pag stress ako, mabilis ako mapikon. Pero hindi ko muna pinapansin na stressed ako.
Yes, that is the first step. Be aware that you are stressed. And then you should know na may mga paraan to manage stress.
So, kaya po ba nung kakarating lang namin ni Simon dito, and ang dami po naming tanong sa inyo, pinabreathing exercises niyo po muna kami?
Oo nga no. Actually, nung ginawa natin yun, we noticed our stress subside and I felt calmer.
Ang galing, no? Kayo din ang tumutulong sa sarili nyo para pansinin na stressed kayo.
Manong G, pag aware na po kami na stressed kami, ano pong pwede namin gawin to manage stress?
Yan ang susunod nating adventure. Aalamin natin ano ba ang mga pwede nating gawin pag stress tayo.
Yan ang kailangan talaga nating matutunan. Stress busters!
Pwede po ba ulit kami sumama ni Simon?
Of course!
Oo naman, Kyra and Simon. Masaya nga kami nakasama namin kayo today. At kayo rin. Sama ulit kayo sa susunod naming adventure as we explore these stress busters together.
Dito lang sa Mind It School, where learning
leads to a better normal.
Una sa lahat, meron tayong kailangang makilala na 5 permanent residents of the brain.
Meron akong hindi gusto pero hindi ko malaman kung ano.
Ganyan talaga si disgust. Another one of the 5 basic emotions.
Ano ba yan? I already told our crew they should get new lights for this part. Hindi na naman ako sinunod.
Uy, anger. As usual, galit ka na naman.
Sa dami ng problema, parang wala na talagang pag-asa. Yung hirap pang edukasyon ngayon dahil sa hirap ng buhay. At may pandemic pa. Yung pagbago ng klima na nakakaapekto sa buhay at pagpasok natin sa eskwela at trabaho. Nakaka-depress.
Naku, sadness. Ganyan talaga ang nararamdaman ng marami, lalo ng mga kabataan. Sa dami ng problema natin, parang mahirap na sila lahat masolve.
Pero, madaming dahilan para magkaroon ng pag-asa. Isipin mo na lang ang nagmamahal sa'yo. Kahit isa lang dun. Di ba dahilan na yun para di ka mag-give up sa buhay?
Uy, sa wakas, dumating ka na, Joy!
Hello, 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 everyone! It's so wonderful to be here with all of you!
Care for yourself, care for others. Do you have a safe space tulad ng isang support group? Ang support group ay binubuo ng taong handang tumulong at sumuporta sa'yo. Hindi ka nila hahayaang mapag-isa at makaramdam ng panghuhusga. Papayuhan ka nila based on their experiences. Hindi ka nila papayuhan ng medical advice na wala namang basehan. Iaengganyo ka nila para ma-improve ang coping skills mo. Ang pagkakaroon ng support group ay importanteng bahagi ng healthy lifestyle. Follow us for more tips and updates at i-achieve na ang 7 healthy habits para sa healthy Pilipinas. Paalala mula sa Department of Health.
Stressed ka na ba? Normal lang yan. Minsan, may mga pagkakataon lang talaga na no-overwhelm at nababahala tayo. Pero ngayon, may katuwang ka na. Ipinakikilala ang Lusog Isip, ang unang mobile app para matugunan ng mental health concerns na iniaangkop para sa mga Pilipino. May mga tools sa app na matutulungan kang mapangalagaan ang iyong sarili at kaisipan araw-araw. Sa Lusog Isip, may tulong na nakahanda para sa iyo sa ilang taps lang. I-download na ang Lusog Isip app para sa Healthy Pilipinas. Sa Lusog Isip app, maaabot na ang tulong na kailangan mo.
Care for yourself, care for others. Lahat tayo gustong mapasaya ang mahal sa buhay. Pero paano mo gagawin yan kung ikaw mismo hindi masaya? Ang stress at pagod minsan na ipapasa mo na sa iba. Subukan mong mag-jogging kaysa magbabad sa social media. Magbasa ng libro kaysa tumutok sa cellphone screens. Instead na makipagtalo sa comment section, i-explore mo na lang ang beauty ng outside world para iwas stress. Kaya, ibalanse mo na ang online at offline life mo. Nakaka-relax na, nakaka-healthy pa. Smile naman dyan! Follow us for more tips and updates at i-achieve na ang 7 healthy habits para sa healthy Pilipinas. Paalala mula sa Department of Health. Care for yourself, care for others. Lahat tayo nagkaka-stress. Yung iba, nakaka-move on agad. Yung iba, hindi. Ito ang ilang palatandaan na serious na siya. Loss of appetite at insomnia. Kawalan ng ganang mag-work o mag-aral. Kawalan ng interes sa mga paboritong libangan. Paggamit ng dangerous ways bilang coping mechanism, gaya ng alak at droga. Your mental health is just as important as your physical health. Follow us for more tips and updates at i-achieve na ang 7 healthy habits para sa healthy Pilipinas. Paalala mula sa Department of Health.
7 healthy habits para sa healthy Pilipinas.
Sabay handa ang balikat ng may karamay sa bigat. Sila'y iniingatan, ngunit sarili huwag kalimutan. Mahalaga ka.
Do it na yan, kalusugan ay unahin at mga nahin ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas ang bawat Pilipino sa mundo. Sa ulado mapitong ito, sa healthy habits go na go. Para sa healthy Pilipinas.
Care for yourself, care for others. Paano matutulungan ang taong may pinagdadaan ng mental health problems? Kaya kung may humingi sa'yo ng tulong, pakinggan mo sila. Intindihin at huwag baliwalain ang nararamdaman nila. Tumawag sa National Center for Mental Health Crisis Hotline o sa mga numero sa inyong screen. Huwag ikahiya at huwag ismolin ang mental health problem. May mga lunas sa paligid mo. Follow us for more tips and updates at i-achieve na ang 7 healthy habits para sa healthy Pilipinas. Paalala mula sa Department of Health. Care for yourself, care for others. Stressed sa work? Kailangan mo ng time out? Rest muna. Take a break. Maraming paraan para makapag-relax. Mag-beach o mag-hiking, movie night o sound trip, yoga o zumba, kumanta o tumugtog, mag-gardening o mag-baking, mag-sports o magpamassage, mag-video games o magbasa. The list goes on, mga ka-healthy peeps. Ano man ang trip mo, mahalagang maglaan ng panahon para sa sarili. Mag-recharge, mag-recover. Follow us for more tips and updates at i-achieve na ang 7 healthy habits para sa healthy Pilipinas. Paalala mula sa Department of Health.
What if you and I had a dream school? Ano kaya yun? Would it have dinosaurs like experiments? Little things that become big. What if we could suddenly see invisible things? Would it have a giant heart or a big, big brain? Or flies into outer space? May sagot sa ating mga tanong, pero tuturuan din tayo magtanong. Okay lang din magkamali, so that we learn so much more. Sa dream school natin, learning is never boring. So it's an adventure. How do we do that? What do we do? With the power of science, art and imagination, all the wonders you will find in the mind is school.
Tara na! Join us as we explore Mind School, the coolest space for science and art ideas.
Step into amazing portals with us, where extraordinary, weird, and mind-blowing connections
come to life. Inhale. Exhale. Inhale. Exhale. Uy! Nagulat naman ako sa inyo. Matagal na ba kayo dyan? Mukhang may bago kang kasama, Mikey ah.
Hi, Manong G. You know, we felt calm na rin looking at you guys so relaxed. This is Mario. Mind mover din siya tulad namin ni Fisher. And sasama siya sa adventures natin dito.
Hi, Manong G! So happy to be here po.
Uy, Fisher? Kala ko ba you're taking a break? Gulat ako, nandito ka rin.
Hi, Mikey and Mario! Yeah, nagbakasyon muna ako to be with my family. Sobrang stress na kasi ako kasi 4 years ko na silang hindi nakita. Eh eto, tumawag lang ako kay Manong G para mangamusta. And timing, they were doing calming exercises. Kaya sumali na ako virtually.
Were you taking a short nap, Manong G?
Hindi. Ito ay isang breathing exercise. Natutunan ko to sa friend ko. At tinuturo ko kay na Simon at Kyra. Mga anak nga pala sila ng mga kaibigan ko na gustong bumisita dito sa Mind School. Simon and Kyra, kilala mo na si Mikey at saka si Fisher, di ba?
Opo, I've been following all the Mind School adventures from the start. Hi, Ate Mikey! Hi, Kuya Fisher! All of your adventures have been so much fun, so it's really exciting to finally meet you both.
Me too. I'm a really big fan of Mind School. We're really happy to be here.
Welcome to Mind School, Simon and Kyra. Get ready for lots of mind-blowingly cool adventures. And I'm happy that Mario is joining you too. O sige, sign off muna ako. See you real soon. Bye!
Hi, Simon and Kyra. Very happy to meet you here. This is your Kuya Mario.
Hello, Simon. Hello, Kyra.
Hi! Actually, matagal na po namin gusto bumisita dito. And kanina, nakaikot na po kami ng onte. Medyo natanggal nga po yung stress namin ni Simon eh.
Hello, Kuya Mario. Hello, Ate Mikey. Mukhang masaya dito sa Mind School. Walang stress. Di katulad sa bahay at sa school.
Great to have you here, Simon and Kyra. Welcome kayo dito sa Mind School parate. Pero, alam nyo ba na normal lang ang stress?
Normal lang pong maging stressed?
Oo naman. Kasi sa buhay, hindi talaga maiiwasan ang mga problema. And because we have to deal with many problems, stress helps us to deal with those.
So, we should always welcome stress, Manong G?
Hindi.
I'm so confused, Manong G. Okay lang ba ma-stress or hindi?
And lahat po ba ng stress ay masama?
Para hindi kayo masyadong ma-stress, thinking about stress, how about we tackle stress as our adventure for today?
Gusto namin yan, Manong G. Siguro kayo rin naiintriga kung ang stress ba ay kaibigan o kaaway.
Sa adventure natin ngayon, alamin natin, lahat ba ng stress ay masama?
Giant Brain, I have a question. What happens to our brains when we're stressed?
Mind School?
Wow! Grabe! Ang laki ng brain!
Not exactly, Mario. This is a special place where we can explain what happens to the human brain when we experience something like stress.
And, oh wow! You can really see inside!
Kuya Mario, can I also see it? Wow! Kita nga lahat dito! Grabe! Pero, Giant Brain, I have a question. What happens to our brains when we're stressed?
Let's go straight to the answer, Giant Brain.
Ikaw ba ay nakararanas ng stress? Kapag ang isang tao ay stress, naglalabas ang katawan ng cortisol o stress hormone. Ito ang nagbibigay sa atin ng dagdag na energy para ihanda ang sarili na harapin ang problema o sitwasyon.
Oh, So pag tumatawid pala tayo or may emergency, natural lang na may cortisol?
Oo, Mario. Kasi cortisol helps your body cope with emergencies. Pero may iba pa ring stresses sa iba pang mga bagay na nakakabahala sa atin.
Kasama po ba dyan yung pag-stressed ako, thinking kung papasa ako sa mga classes ko? My brain also releases cortisol?
Yes, kasi cortisol makes you more aware. And kailangan mong maging aware para maisipan mo ng mga tamang solusyon ang mga bagay na yan.
How about po when I really want to join a basketball team, and bago pa lang ako, and every time I try, parang ayaw pa rin nila ako isali.
Yes, cortisol din yan.
Okay naman pala itong cortisol na to for us. So, why are we so worried about stress?
Oo nga, Giant Brain. If stress is normal, pwede bang baliwalay na lang natin ang stress na nararamdaman natin?
Normal na ikaw ay makaramdam ng stress. Pero kung madalas ang pagtaas ng cortisol levels mo o chronic na ang stress, ito ay may negatibong epekto sa iyo.
Pag palagi palang mataas ang stress at cortisol levels, hindi pala yun mabuti para sa atin. Bad news pala yun.
Tama. Pag ganyan na, problema na ang stress kasi masama na ang epekto sa'yo. Madami ang pwedeng maging negatibong epekto pag sobrang taas ng level ng stress mo.
So, Giant Brain, ano ba ang mga negatibong epekto ng mataas at madalas na stress? Like ako, ang dami ko pa kasing chores sa bahay, aalagaan ko pa yung kapatid ko, and ang dami ko pang test sa school.
Wait, Giant Brain, I also have a question. What will happen to my brain pag stressed ako dahil mga kaibigan ko gusto ako sumama sa gimmick, pero ayaw naman ako payagan ng parents ko?
Ako naman, kapag meron akong gustong i-open up sa mom ko, pero hindi ako sigurado kung paano niya tatanggapin o kung maintindihan niya ba ako. Hindi ako makahanap ng tamang chance, kaya nasistress ako. Giant Brain, what does my brain experience kapag ganun?
I also have a friend na teenager pa lang, nagtatrabaho na. At ang boss niya, sinisigawan siya sa maliliit na bagay na mali niya.
Ako naman, I know of a kid who gets bullied a lot in school. Lagi siyang pinagtatawanan kasi yung shoes niya daw masyadong malaki o kaya yung bag na gamit niya pamalengke na bag.
Grabe. Oh, I also asked some of my friends, ano ba yung top things na nakaka-stress sa kanila? And ito yung sabi nila.
Nai-stress ako kapag sunod-sunod ang utos sa akin dito sa bahay, lalo na't may iba pa akong ginagawa.
Minsan nakaka-stress yung mga ibang requirements na feeling ko hindi naman kailangan, katulad ng pag-video ng mga sayaw sa physical education or PT.
Pinagkakastressan ko dealing with relationships, friendships, or with my significant other, or even my family.
So right now, it's meeting academic deadlines and also thinking about job opportunities after college.
Nai-stress ako sa mga groupmates kong pabigat at ghoster. Yung tipo magpapakita lang sila if may deadline at meron pa yung ipapasa nila. Parang hindi mga college, no?
Ang nagpapastress para sa akin ay ang pag-manage ng aking time at pagsasabay ng school projects, exams, at extracurricular activities. Lalo na't ngayon lang kami nag-face-to-face at meron pa rin COVID.
So the things that stress me out right now mostly revolve around school, applying to the colleges I want to get into, and also submitting my homeworks on time.
Ang pinaka nakaka-stress sa akin ay ang pag-iisip ko anong career ang gusto kong gawin habang buhay at ang pagkakaroon ng responsibilidad bilang teenager na magdesisyon para sa aking kinabukasan.
Isa sa mga bagay na malakas makapagpa-stress sa akin lately is when hindi ko nasusunod yung mga nasa calendar of activities ko. Because in that way, nafe-feel ko na I'm very unproductive.
Wow! Buti na lang marunong mag-handle si Giant Brain ng marami niyong questions. So, Giant Brain, anong nangyayari sa katawan pag mataas lagi ang stress levels?
Kapag ikaw ay stress, tumataas ang cholesterol at blood pressure level mo. Baka atakihin ka sa puso. Pwede din malagas ang iyong buhok, mag-dry ang balat mo, magka-acne breakout ka, magka-joint and muscle pains o sumakit ang tiyan. Yan ang epekto kapag madalas ka ma-stress. Ang iyong immunity sa sakit ay bumababa din. Kapag stressed ka, pwede ka maging sakitin o matagal bago gumaling.
Oh no! Na-stress akong malaman ng effects ng sobrang stress.
Huwag ka masyadong mag-alala, Mario. Kasi, pag aware ka na ngayon na yan ang nagagawa ng stress sa katawan mo, maiiba na rin ang pananaw at kilos mo.
Uy, wait! Sa katawan pa lang yan. Napansin ko na kapag stressed ako ng matagal, nag-iiba na rin yung moods ko. Giant brain! May epekto din ba ang stress sa emotions at ugali natin?
Masama rin ang epekto ng stress sa ating emosyon at pag-uugali. Mapapansin ang pagiging bugnutin, malungkot, depressed, balisa, masungit o hirap sa pagtulog.
Sabi ko na nga ba, malaki ang epekto ng stress sa emotions natin. Kaya nag-iiba din ang moods natin. Eh pag ganun, bad vibes nga magiging signal natin sa mga kasama natin.
Oo nga. Kaya pala pag stressed ako sa grades, nasa-stress ko din pala yung family ko and lalo na yung friends ko. Kasi nga, hindi ayos ang emotions ko. So, paiba-iba rin yung moods ko. So, affected yung relationships ko with my family and friends.
Stress affects me and everyone around me pala. Pwede rin ako magkasakit pag patuloy-tuloy mataas ang stress levels ko.
Buti na lang, dito sa Mindy School, nandyan lagi si Giant Brain na pwede nating tanungin tungkol sa mga brains natin.
At hindi nasi-stress si Giant Brain kahit na ang dami nating tinatanong.
So kung normal at hindi naman pala natin may iwasan ng stress, ano dapat ang attitude natin palagi?
That's right, Kuya Mario. If everything is stressful in school and at home, especially for teenagers like Kyra and I, what can we do?
Care for yourself, care for others. Mahalaga na aware tayo sa ating mga nararamdaman para malaman natin ang mga triggers nito. Maging in control sa emotions mo. Gamitin ang mga mood-tracking tools na ito para mas lalong maintindihan ang emotions mo. 1. Mood Journal. 2. I-download ang Lusog Isip app. Ang emotions at feelings ay bahagi ng mental health. Ugalian itong bantayan at pahalagahan.
Hey, Giant Brain! We have one last question. If we cannot get rid of stress, what should be our attitude towards stress?
Ano nakikita
Mikey,
mo?
tingnan mo. Tingnan mo.
Hi! Thank you, Giant Brain, for showing us what happens to our brains when we're stressed. Ngayon, mas naiintindihan ko na talaga ang stress. Parati natin sinasabi ang stress sa everyday conversations natin. Pero ngayon, gets ko na talaga siya.
Oo nga, I really thought that all stresses are bad and that some people are just unlucky to have stress and that some people don't have stress at all.
Oo nga, Simon, no? Normal lang pala talaga ang stress. Kaya dapat, alam natin kung anong gagawin natin pag stress tayo.
Alam nyo naman dito sa Mind School, meron laging special na lugar para maintindihan ang iba't ibang mga bagay. At ang stress ay isang bagay na sa tingin ko ay napaka-importanteng maintindihan ng lahat, kahit ano pang edad nila.
Manong G, tingnan mo si Mario. Sinusunod yung example niyo.
Mabuti naman. Baka stress lang siya lately.
Ay, sorry. Nadala ko dun sa breathing in, breathing out. Yung ginawa mo kanina, Manong G. Hey, Giant Brain. We have one last question. If we cannot get rid of stress, what should be our attitude towards stress?
Ang stress ay normal. Ang mahalaga ay conscious ka kapag ito ay nakasasama na sa iyong kalusugan. Dapat matutunan mo kung paano ma-manage ang stress.
Oh, so the first thing to do pala is to be aware when you're stressed so you can manage it.
Ibig sabihin, pansinin mo ang sarili mo kapag stressed ka.
Ang mental health ay mahalaga sa ating pangkabuuan at individual na abilidad magtrabaho, mag-isip, makaramdam at mabuhay. Kaya naman ngayong panahon ng pandemya, huwag kalimutang pangalagaan ang ating mental health tulad ng pag-aalaga natin sa ating physical health. Ang self-care ay isa sa pinakamabisang paraan upang pangalagaan ang ating mental health. Ang simpleng pag-exercise o pagtutok sa ating mga hobbies ay isang paraan ng self-care. Care for yourself. Bigyang oras ang sarili at mga bagay na nagbibigay sa'yo ng saya. Nagkakaroon ka na rin ba ng Zoom fatigue dahil sa meetings o di kaya ay sa online class? Huwag kalimutang magpahinga. Importanteng maglaan ng break at ipahinga ang utak. Maglaro muna ng paboritong games. Malaking tulong ang breathing exercises sa pagpapakalma at para maibsan ang ating pakiramdam. Matuto ring mag-set ng boundaries para sa iyong work-life balance. Matutong irespeto ang work boundaries ng iyong mga katrabaho. Dahil sa pandemya ang ating kinakaharap, hindi mapigilan na tayo ay mapalayo sa ating mga mahal sa buhay. Ngunit hindi dapat maging hadlang ang distansya upang tayo ay mag-hashtag care for others. Kumusta mo na ba sina lolo at lola this week? How about sina mama at papa? Mga kapatid, kaklase? Kung hindi pa, ang isang simpleng kumusta sa pamamagitan ng video or voice calls o text messages ay tiyak na makatutulong sa kanilang mental well-being. Care for others, ang isang malakas na support system ay nakakatulong rin sa pagpapabuti ng ating mental health. Kung ikaw o sino man sa iyong kakilala ang nangangailangan na makipag-usap sa isang mental health professional, tumawag lamang sa mga numerong ito mula sa National Center for Mental Health.
Beginning shortly. Thank you. Once again, we're calling all participants to please go back to their seats as our afternoon session is about to begin. Thank you.
Centered around the theme, mental health is a universal human right, harmonizing health service providers network in Bicol.
Good afternoon, everyone. We trust you enjoyed a delightful lunch, even despite the delays. But despite all of that, we're equally excited to delve into part two of our program, mainstreaming mental health care, psychosocial support, treatment, and substance use prevention through strengthening health service providers network.
But before we continue, we would like to acknowledge the presence of Honorable Mayor Esther E. Hamor of City of Sorsogon. Good afternoon po, Mayor. And also to our cluster head of the Non-Communicable Disease Prevention and Control Cluster, Dr. Monray Isaiah Mancilia.
Thank you so much po for being here and supporting us.
So to continue, mental health is a basic human right for all people. Everyone, whoever and wherever they are, has a right to the highest attainable standard of mental health.
This, of course, includes the right to be protected from mental health risks, the right to available, accessible, acceptable, and good quality care, and the right to liberty, independence, and inclusion in the community.
To commence our afternoon discussions under the theme The Success Stories, it is with great pleasure to introduce our distinguished speaker. She is a rural health physician at the Sorsogon City Health Office, handling epidemiology and disease surveillance unit and drugs-related concerns, a DOH accredited physician, a drug rehabilitation practitioner of Sorsogon City Health Office. Let us give a warm welcome to Dr. Jaisal S. Calleja.
Good afternoon, everyone. On behalf of my Honorable Mayor Esther Amor, I will be sharing with you our small steps towards Bagong Umaga, our CBDRP, Serbisyong May Puso. Our mayor just arrived from Manila and directly come here to grace our occasion. Palakpakan naman natin ang suporta ng aming mayor. Thank you, Mayor Esther Amor. To start with, let me give you demographics. Next slide, please. Demographics of Sorsogon City. Sorsogon City is the third-class component city with a total population of 184,896 spread across its 64 barangays. And this is dubbed as the gateway to southern Philippines, being the transshipment point from Visayas in Mindanao. Sorsogon City is the capital city of Sorsogon Province, the land of Kasangayahan. Next. So, in 2016, naalala niyo po ba yung tukhang lahat po tayo caught ang surrendering drug users, pledging to cut their habits. We tried to make up for the absence of recovery program by organizing activities such as dance workout, Zumba, cleanup drive, tree planting, and moral recovery, and etc. Next, please. So, report from the PIDEA, the city falls under this category. So we have 15% barangays considered unaffected. We have 26 barangays or 26% of our barangays classified slightly affected of drug. Affected. Meaning the presence of users and pushers, good to we have laboratories for illegal drugs. That makes a barangay severely affected with the presence of a laboratory. Next, please. We classify our PWOODs in order for us Sorsogon City, we have 74% of our PWOODs fall under low risk category and 24% rate category and 2% with high risk category. Those under moderate and high risk, we submitted them for us to evaluate their dependence for substance use. So 90% under mild, only 7% moderate, and 3% for severe. if we can see, the majority of our PWODs should be given community-based drug rehabilitation program. And those belonging to moderate and severe, we refer them to our Malinaw TRC, and we have memorandum agreement for that referral system. Next, please. It is a common misconception that drug dependents can no longer recover. So we go down the barangay level to capacitate our BADACs and provide reliable information to debunk the myths and misconceptions on addiction. We provide that treatment is available. Do our best to make it um, in responsive to the needs of our people. So this is in the community. We conducted the CBDRP intervention. We scheduled it every Thursday, and the screening and assessment every Friday. We used to be, we online session and time. So these are the summary of demand and production activities. The team was created and organized through an executive order, and we capacitated the technical working group of our Sorsogon City Anti-Drug Abuse Council. Also, an office established for CBDRP in Balay, Silangan. Policies were formulated. Our city councilor authored a localization of law. We named it HAMOR, Harmonizing because our mayor and another our city councilor also sponsored, this is Councilor Tess Gonzalez, sponsored a resolution declaring workplaces as drug-free. That's why even other non-government offices requested us to do drug testing to declare them as drug-free workplace. Streamlining processes also to access services, a flow chart was developed so that our PWODs would be able to easily access services available for them. And then collaboration and partnership was established both for government agencies and GOs and private sectors. Then, ito yung walang katapusang preventive education campaign continuously being done. And we do radio programming and TV guesting. We use social media ad. We have a advertising media and symposium and forums, both for the schools and the community. Appropriate and responsive interventions, rehabilitation and reintegration are being provided to our PWODs. Data reconciliation, this is very important activity we conduct because with here, nalalaman namin sino na yung namatay, who transferred out, who transferred in to continue the intervention of PWODs. We also know who were among the PWODs were arrested and under plea bargaining agreement. And we do monitoring and evaluation, and part of this, we conduct drug testing, not only for PWODs, but also for our BADAC. And we require BADAC to submit their monthly report for monitoring and evaluation. Next, please. Before, a team is organized to do screening and assessment. And now, kahit mag-isa na lang ako, kaya nang gawin because pa isa-isa na rin naman ang pumupunta. Ito yung mga kapatid nating PDLs under plea bargaining agreement. Next, please. We recognize that addiction is a brain disease. Thus, we incorporated mental health in our intervention. not only for PWOODs, but also among their families as codependents affected by addiction problem. Peer counselors training was also conducted among youth leaders and school and communities. Next, please. This is one of the sessions with our PWOODs on mental health enhancement, ensuring sanity, implicate, and response during the crisis. Next, please. Orientation and assessment for skills and livelihood training. We aim for our PWOODs to have a finishing well. So PWOODs, we train first and we capacitate them before giving livelihood to ensure na hindi na sila babalik doon sa ibang pinagkakakitaan. Next please. Nagbibigay ang Sorsogon City ng angkop na hanap buhay for their interest. We do the awarding of tricycle franchise to PWOODs. And next please, we train them for basic swine management production seminar. Dahil dito, handa na sila sa marangal na hanap buhay. So part of the monitoring, next please, we do conduct surveillance drug testing, as I've mentioned, not only for our PWOODs, but also for the BADAC or the Barangay Council as model, for them to be declared a drug-free workplace. Next, please. So now, here are our graduates ready for social reintegration, tagged as recovered users. I would just like to share with you the testimony, some of the testimonies of our PWOODs. Sabi dyan ng isa naming PWOOD, akala ko wala nang katapusan ng saya at layaw ko. Dahil sa droga, napabayaan ko ang kalusugan ko, trabaho, pati pamilya. Salamat sa bagong umaga, ako ay nabigyan ng bagong pag-asa, nagkaroon ng focus na ayusin ang aking sarili, trabaho, pamilya, at maging kagamit-gamit na mamamayan ng Sorsogon City. He is GC51 male, recovered and reformed, passed the nursing licensure exam after the reformation, now our advocate. Another one is Mr. JM. Dati may magandang negosyo ako, pero nawala dahil sa masamang bisyo. Nakulong ako, naghirap pati pamilya ko. Salamat sa reformation program ng CBDRP, binuksang muli ang pag-asa na magbago at tahakin ng tamang landas ng buhay. Siya si JM, recovered user, now IT hard ng aming local traffic enforcer SK3. He monitors the surveillance camera of the Sorsogon. So indeed, CBDRP works for Sorsogon City. Sorsogon City believes that recovery is possible with CBDRP, thus committed to providing PWOODs access to comprehensive treatment, rehabilitation services through Bagong Umaga. Indeed, with Bagong Umaga, the future looks brighter for our PWOODs. Next po. And na-certify na din po yung aming CBDRP. Meron na kaming certification from Department of Health, proof that we only give standard and quality service to PWOODs. So indeed, teamwork works. Without the teamwork, we cannot achieve this. Next, please. That's why all our efforts last year was recognized by Department of Health. Our mayor received the award Best in Established and Functional Screening, Brief Intervention and Referral for Persons Who Use Drugs. Thank you for recognizing our effort. Success is best when it is shared. Thank you and good afternoon.
A huge thank you to Dr. Jazel Calleja for sharing the inspiring story of your community-based drug rehabilitation program. It is clear that your program is making a real difference in the lives of people struggling with addiction. It's clear in their stories, and we hope to see more stories moving forward. Now, we are also grateful for your commitment to sharing your program success with others, where they can also replicate in their own localities and help even more people to recover and build healthy, productive lives. At this juncture, continuing with our series on our success stories, it is with great pleasure to introduce our distinguished speaker. She is a passionate advocate for mental health and she has made significant progress in expanding access to services in Tabaco City. She is a university scholar in the University of the Philippines, Diliman, where she finished her Bachelor of Science in Zoology. She also graduated magna cum laude with Bachelor of Science in Nursing and Public Health from Newman College, Aston, Pennsylvania, USA, where she was a recipient of the Excellence in Leadership Award. She completed an executive program on leaders in development at John F. Kennedy School of Government in Harvard University, Cambridge, USA. She completed her master's in public administration at the University of the Philippines, National College of Public Administration and Governance with a summa cum laude grade point average. Everyone, please give her a warm round of applause. Honorable Mayor Crisel Lagman Luisto. A round of applause, please.
Maray na pagkahapon po sa kapos. Good afternoon to everyone. Mayor Esther Hamor called me this morning and asked me if I was going to be attending the today's session. And I said definitely. And I said, sabi ko, are you going to be presenting? Sabi niya, I will ask my doctora to present on my behalf, but I will be there. The fact that local chief executives are here to support mental health and this Congress is a big indication that we understand that mental health is an integral part of health, and we cannot talk about health without dealing with mental health concerns. Pikulon ko na sa napo, ta sa hiling ko gabusman kita nakakasabot. Ang sarong estudyante, Sir Buen, pag nagaagi ki stress sa pag-eskwela, no? Ang mga manifestations kaini, bako na emotional and behavioral manifestations. May physical manifestations man ini. Sleeplessness, no? Mahihiling mo, so weakness, no? Lack of appetite, or sometimes increase in appetite. So may mga physical manifestations. As a nurse, and I think it has been very helpful that the basis for my studying nursing was really community health nursing. So in SIT, it was holistic. We did not just deal with the patient's physical fitness or well-being. We also looked into the social, even the spiritual, even of course, the mental and emotional state of the patient. We did not just look at the individual as the patient. We look at the patient as part of a family. Kung may helang ang sarong miyembro kang pamilya, bako masana sumayhelang so individual. Nahiling ta na may effect ini sa mga pag-iriba niya sa pamilya. Tibad sa na dyan, nagka-stress man sa ina pag nahihiling na depressed ng aki niya. And dahil dyan, syempre, naghahanap siya kipaagi para mapabulong ini. And with the dearth, diiton sana ang satuyang mga mental health practitioners, diiton ang satuyang mga psychiatrists, ipisilon makahanap, no? Si doktor. And syempre, burden ka na kang financials man. Pag nagpabulong ka, lalo na kung medyo harayo ang sa imong makuko ang doktor. So, nahihiling ta po na bakusa ng individual ang pasyente, ang pamilya, nagiging pasyente man. And bakusa na sa pamilya ang pasyente, ang komunidad nagiging pasyente. So kung hilingon ta ko ang lambang pamilya may helang, magkakaibay ni ki-impact sa bilog na salud kang komunidad. Kasi bago si Doktora spoke about drugs and the mental effect of drugs on individuals, families, and communities. Yes, siguro kita mga programa na pa-rehab sinda. But you bring them back again after rehabilitation to the same environment. Not to the same environment that led them to use drugs. So what I'm saying is that we cannot just take the individual, rehabilitate the individual, and then bring them back to the same environment. We have to change the environment. And that is why I'm so happy that when I entered St. Ellis, sabi ko, ano nangyayari digdi? Dilubyo sa baba, dakulo ng mga estudyante. Sabi ko, hindi mo lamang ako sinabihan na araw kayo ni pala. Ang dami pala ninyong trainings na ongoing vis-a-vis this Congress. People are now beginning to know that mental health is not taboo, that mental health should be taken seriously. And it should not be, something na ikasusupog mo, kundi something that has to be addressed, and you have to stand up and speak out about it. That is my introduction, because this presentation will be two parts. I will be introducing some of the best practices of Tabaco City, not the regular structured programs, but something that I think would elicit interest in you, not just local governments, but also perhaps schools and other partners in the community, that you can also do the same. And then second, I have asked our expert from Tabaco City, our nurse, and she was the one who established and started our mental health program only this year. So baguhan sa na po ining structured na. Okay? Pero istorya ko sa ido na haloy ng panahon kami nagkasuporta talaga sa mental health. So Teen will now take over after I present just two programs that I think would be very interesting and very replicable. Let me just start by saying that the mental health program of Tabaco City started way before my term as mayor of Tabaco. And we were so blessed of the existence of Brothers of Charity in Tabigian. Nasa po si Father Vic. Si Father Vic. Okay, Father Vic. Brother Vic, kasuarin ka mo nagpuon. When did you start in Tabaco? During the incumbency of Mayor Alex Borse. I think that was in 2000 na ba? 2004. 2004. Okay, I started as mayor in 2007. So that time, when Uncle Alex learned about the program, ang ginawa niya lang very simple. Hinatod niya sana sa mga pasyente. Hali duman sa kampanaryo kan Tabaco, pasiring sa Tabigian. So saan ang kinibo niya po? But dakulao ng tabang ang access. Taharayo po ang Tabigian, nasa upland kan Tabaco. Okay? So that access gave them a chance. Every week, I think that was a Thursday, every week, nakakaduman sinda sa Brothers of Charity. And we continued that, Maris. But when I became mayor, I added a bit more support to the program. It was not just the transportation that would bring patients to and from back to the centro, sa Tabigian, but also added a small amount. I think we started with 100,000 pesos para sa nasa pag-augment para sa mga indigent ning pasyente. And over the years, it has grown and grown and grown. And I think now we have more or less 400,000 to support the, not the inpatients. Before we were supporting inpatients. Ngayon wala nang inpatients sa Tabigian. We're supporting indigent patients, I think, for their consultation. Ang counterpart namin as of now, ang MOA namin has been changing over the years. I think it's 500 pesos per client. And then ang counterpart ng client, I think, is 150 pesos. Okay? And then igwa pa kitang suporta para sa bulong maninda, pero ibang pundo naman ang pigkakwaan. And then we also have a small amount for family sessions, support groups, because we have family support groups in barangays, just to allow them to have a breathing space. No? Kapag urulayan ng mga common problems nila. Sometimes all you need is someone to listen to you. And when you see that, hindi pala ako nag-iisa, that would push you. No? Push you from day 1 to day 2. Sometimes yun naman lang, hindi naman kailangan long-term kaagad. Small steps from today to tomorrow. And so thank you, Brother Vic, for the partnership that has spanned for like how many years now. And mamaya po, ipapakita natin kung ano ang ginagawa ng Tabaco City to advocate for mental health. But before that, alam naman natin lahat tayo affected ng pandemya. Diba? Grabe ito. Naka-face mask ka, di mo nagkakahiriling na ang mga panlok. Social distancing, di ka na maka-embrace ka, di mo maski loved ones mo. No? Tapos di ka na. Grabe, we were apart. And that took a toll on everyone's mental health. Tell me, apektado sa mental health nito during the pandemic? Yes. And so, nung nag-lift na sa ibang restrictions, normally Tabaco City would come together every Tabac Festival to do something as a group, as a LGU family. It may be just making, having fun on the stage, mga katarago, mga talento sa pagkanta, sa pagbayli, sa pag-arte, nagaluwas sa entablado. But this time, wala kaming stage. Kasi bawal nga yung mga ganong klaseng mga pagtitipon. But we have a 20-hectare property in San Vicente that became our stage. So we opened Hiraya Manawari Nature Park. It's a combined work of all LGU employees, utilizing mga nagkararaot kan Typhoon Rolly, na mga basura na huna tadain ng gamit, pero na-upcycle ito duman sa park. So it all started with an idea that we had to come together to do something as a community, and then it inspired us to utilize the garbage that was all around us. Not garbage at all, because once you have upcycled them, they become repurposed. May bago na sindang purpose. And sabi ko nga sa sadiri ko, bako man sa mga basura ang pigre-repurpose. Pati ang mga tao natatawan ti panibagong pag-asa. And so, I would like to present Hiraya Manawari jingle, and I hope that you would see how it started. It started with a dream. Hiraya Manawari means sana'y mangyari. And indeed, it became a platform for us to come together and work together. And also, it has been a respite for all the mental concerns and issues that were bugging us during the time of the pandemic. So I present to you Tabaco City's Hiraya Manawari Nature Park.
Hingiling mararating, hirayaman, hingiling mararating, hirayaman, unti-unting mararating, hirayaman, mga paro-parong masasayang lumilipad. Masdan mo ang mga halamang sumasayaw dahil dito ka napadpad sa lugar kung saan ng ating imahinasyon ang siyang magbibigay ng kulay at inspirasyon sa bawat gamit na kala mo ay patapon. Dito'y lahat merong bagong pagkakataon. Sama ng iyong pamilya, ayain na ang buong barkada. Buti ng paraisong pinuno ng sigla pagkatuwaan. Mga pangarap pag-usapan, limutin ang pagkaalinlangan. Iraya Manuel. Marami kang pwedeng gawin, sa akala mo'y basura lamang. Marami kang pwedeng maging, basta tumayo ka't lumaban. Marami kang pwedeng marating, kung saan mo man hinihiling. Simulan mo nang tuparin, pangarap mo ay abutin. Tulad ng paru-paro, bago ganap na makalima. Gusto mo nang umunting, gumagapang na higat. Sinubok ng mundo at panahon, mamangha sa kayang gawin ng Panginoon. Sama ng iyong pamilya, ayain ang buong barkada. Limutin ang paraiso, pinuno ng sila pagkatuwaan. Mga pangarap pag-usapan, ano man ang iyong pinagmulan, sino ka man. Iraya Manuel. Iraya Manuel, hiling mararating
tulog tayo kahit isang taong porsyento ng tubig. So, bibigay namin yung link po just in case you want to see the full movie entry. Palakpakan taman po, okay? So, hindi masyadong clear yung sa teaser, kaya nga ni teaser pang illicit lang ng maintriga lang tayo. So, Brother Vic in this movie was one of the patriarch, tama? The patriarch. And meron siyang apo na may sakit. So, para sa kanya, tabu yun. Makakasira yun sa pangalan ng pamilya. So, kailangan i-ostracize, dapat itago kasi nakakahiya. Nakakahiya. So, you will see how Brothers of Charity as an institution was able to rehabilitate not only the family, no, but also change the mindset of Brother Vic. No? So, I won't be a spoiler kasi baka gusto nyo panoorin yung short film nila. But it also brought out some na hindi lang yung kliyente ang pasyente. Kasi doon si Doktora Noblesa, isa lang po ang doktora namin doon. And she sees how many patients? Ilan? 300, 400, 500 patients. No, so far sa Tabaco, meron kami around 2,000 patients, no, being catered by Brothers of Charity. Ganun po. Yung pa lang yung mga nagka-come out to admit that they need help. That they need help. So, si Doktora Noblesa doon sa movie, dahil masyado siyang overwork na rin, no, sa pagsuserve sa kanyang mga kliyente sa facility, nakapabayaan niya na rin yung needs ng kanyang family. Her own personal needs, pati yung needs ng kanyang anak. I think there was a scene there na pinapakita ng anak niya na ang galing-galing ng kanyang grades and wala talaga lang siyang time to listen to him. So again, you will see that caregivers also need care and the families of caregivers are sometimes the victims also, no? Of well, perhaps you're so passionate about your work that you forget that there are people, especially your children, who need you too. So this will segue to the structured programs of Tabaco City. We use art, we use entertainment to educate. I think the best way to reach out and to advocate to people is to use entertainment. So we have maximized that to the hilt in the city of true love. So ngayon po, nahugunta naman po si Teen because she's going to present, no, the structured programs of Tabaco City. Again, let me acknowledge my team from Tabaco City. Please stand up. May duwa kaming doktor po, Digdi. Okay, and yan po si Kagawad Insit Tango. Siya po ang sa Kagawad on health. And of course, Teen will now be presenting our experiences in the city of love. Mabalos pong dakula. I hope that this is able to also inspire you to do something similar. Just mabalos po. Thank you so much, Mayor Cristel. It is always a great privilege and honor to work with a hardworking and supportive mayor. Thank you, Mayor Cristel. So to continue po our best practices at the mental health. Second slide, please. So we would like to present our mental health ordinance, the city ordinance number 029 of 2019, entitled An Ordinance Providing for the Mental Health Program and Delivery System in the City of Tabaco. So dito po nakapaloob ang creation of the Tabaco City Mental Health Committee, the community-based mental health care, the capacity building, reorientation and training, mental health scholarship grant assistance, appropriation allocation of 2.5 million annually, psychosocial and psychiatric services, to include the Kabataan Hub at the Tabaco National High School, our newly established mental health office, the Brothers of Charity at Tabigian, and the Barangay Health Centers. So next, please. Okay, this is the front and last page. Creating the Tabaco City Mental Health Committee, identifying its members, their duties, functions, and other purposes. Okay, next, please. Okay, we have included in the Google Map the location of our mental health office at in Tabaco City. So dyan, pwede nyo na po siyang malocate through Google Map. Sa likod lang po siya ng City Health Office, bagong building lang po siya. So next po, sir. So this is our office, outside and inside. So what we are doing in the office is we give the initial assessment of referred and walk-in patients. So when we say referred, this comes from different barangays, different establishments, and different schools in Tabaco City. So to MHGAP trained doctors, and we also refer to BUC Holy Face and at Don Susano Rodriguez. And we did PFA and MHPSS. Okay, next po. Health Committee. That was last year. So yung succeeding months, every month na po kami nag-meet to discuss future projects, future programs, and future activities po na kailangan sa mental health program. So next po. So sorry po, medyo mabilis na tayo. So sa community-based mental health services, we provide funds for the purchase of psychotropic medicine. So aside from and the gender and development fees, and for 2024 we have 130,000. Actually sabi sa akin ni Mayor kanina parang kulang yung 130,000. So definitely parang mukhang dadagdagan po ni Mayor yung budget namin. Thank you po, Mayor. So we also provide work for recovered mentally ill patients. Currently, we have 3 employees under the mental health office, and yung po, siya yung cold chain manager namin during mobile blood donation. Yung isa po nasa family wellness clinic, lying in clinic, and yung isa po nasa Senro. And then, providing psychological first aid and mental health psychosocial support. We did that during evacuation at the evacuation centers. And nung nagkaroon ng mga suicide cases po sa Tabaco, actually hindi naman marami, 2 lang naman. So pumunta po kami doon sa family nung nag-suicide. So what we do is yung first time namin nalaman, and then we do that every week for follow-up po doon sa family. Next po. And then, yung na-cater po namin, since na-establish po yung mental health office nung February pa lang of this year, 23 patients po were initially assessed at the mental health office using our assessment tools. So those were walk-in patients and referrals from schools and barangays. Out of these 23, 10 patients were seen by Dr. Lauren Bolilan, our MHGAP trained doctor, and 2 with regular follow-up check-up every 3 months. So 2 patients were referred to Dr. Elaine Romano, but these were paid patients po. 3 patients were referred to Brothers of Charity, and 2 patients were referred to Kadlan. Okay po. And 6 patients were given psychological first aid. The next po. Okay, we also established the referral system. So hindi ko na po siya i-discuss kasi parang limited na po yung time. Parang yung patient, pag pumunta, and yung known patient, kung saan po siya pupunta. So hopefully, sooner, baka by next year, meron na po kaming acute psychiatric clinic unit sa Ziga District Hospital. Next po. And then, ito po yung picture nung co-chain manager namin. Yan lang po nailagay ko. So, next po. And then, we also, ayan na po, yung na-mention ko kanina na we provided psychological first and then MHPSS at the evacuation centers. Okay, next please. Okay. Sa evacuation center pa rin yan ginawa namin. Okay, next po. So, yung nurse in charge po ng mental health program din po sa DepEd, nakipag-collaborate na rin po with our office. Okay, next. We conducted mental health awareness to different barangays of Tabaco City to include adolescents, youth, women of reproductive age, and pregnant women and to 4Ps. Okay. Also to government and private offices in Tabaco City. Okay, next po. Yan, yung pictures po namin yan during the conduct of mental health awareness. Okay, next po. Okay, next. Okay. Yung recent activity namin in celebration with the Mental Health Week noong October 9, nag-conduct po kami ng candlelight parade. So that was very successful and that was graced by our very own Ma'am Windalyn Baluis and Dr. Zenit from Provincial Health Office. Ayan po. Next po. Okay. Okay, we have ongoing mental health awareness to school. So yun na po yung ginagawa namin ngayon. Nag-school hopping na po kami kasi kami makapunta ng barangay because of the election ban. So after election, tutuloy-tuloy na naman po kami sa mga barangays. Okay, next po. So yun, psychological first aid to the family of the suicide case. Okay, next po. Okay, yung ways forward po ng Tabaco City. So, establishment of mental health hotline. So, yung title pa lang namin, di pa po yan finalized, pero binigyan na namin ng title, yung Reaching Out with the Heart. That is under Gender and Development Fund and will be manned by DOH-trained youth ambassadors. So, our training schedule will be on December 26 to 27. Okay. Establishment of Kabataan Hub to the different schools in Tabaco. And also, we will conduct train peer counselors po. We will also conduct mental health awareness to employees of different business establishments and LGU. By next year, pag provided na po yung budget, we will conduct training to barangay health workers, CRWs on PFA and MHPSS. We will also train midwives, HRH on PFA and MHPSS. And we are also looking forward po, Ma'am Wendy, for our PhilHealth accreditation. Okay, next po. Okay, thank you very much po and good afternoon. Again, thank you Mayor Lagman and Ms. Christina Bongat for your very informative presentation on community-based mental health services and also the videos presented. So your presentation gave us a bigger picture of community-based mental health services in our community. And we are truly grateful for your dedication to raising awareness about these important services.
Once more, we extend our sincere gratitude to Honorable Hamor and Dr. Calleja from Sorsogon City and Honorable Lagman and Ms. Bongat from Tabaco City for generously sharing the success stories of the community-based services provided to our service users, encompassing both mental health and substance use. It is truly inspiring when we see our local executives be involved in the implementation of the mental health in their respective areas, and we're also very impressed that the people at the ground level are very invested in mental health. Your contributions are invaluable, and we truly appreciate all your insights. We acknowledge that community-based programs offer significant benefits to individuals, empowering them to enhance their quality of life and foster independence within their local community.
And now to continue with our next topic on the On the facility-based mental health services and treatment, these services are primarily designed for individuals requiring intensive support on their journey to recovery and building a brighter future while managing their mental health conditions. This afternoon, we are privileged to be in the presence of two distinguished guests from renowned facility-based institutions.
First off, allow us to introduce a place of profound importance in our region's mental health landscape. The Don Susano J. Rodriguez Memorial Mental Hospital, located in Pili, Camarines Sur, stands as a beacon of hope and healing for those in need of mental health services. This distinguished institution is dedicated in providing comprehensive and compassionate care to individuals on their path to recovery. Today, it is an honor to delve into the invaluable work and contributions made by this institution. Leading this enlightening discussion is none other than the head of the Department of Psychiatry at the Bicol Medical Center, Dr. Edessa M. Pardelagidao, MDM, DSSP, FPPA. Please join me in giving her a warm round of applause.
Aray na hapon po sa Indogabos. Pero bago po ako mag-start kang sa kuya pong presentation, which is facility-based services and treatment, mapuon muna po ako sa pag-introduce about Bicol Medical Center, Department of Psychiatry through a video presentation.
Maray na aldaw sa Indonggabos. This is as we say in Bicol, good day to everyone. I am Dr. Orville Chespando.
Maray na aldaw sa Indonggabos. This is as we say in Bicol, good day to everyone. I am Dr. Orville Chespandes, the training officer of the Bicol Medical Center Psychiatry Department. And today, I would like to tell you relevant information about our training institution. The Bicol Medical Center Psychiatry Department initially started as the Don Susano Rodriguez Memorial Mental Hospital in 1960. At that time, the National Center for Mental Health was looking for satellite hospitals, especially in the far-flung provinces, in order to provide mental health care services to the underserved. Don Susano Rodriguez was one of the hacienderos in Bicol region, and he owned vast real estates, and at that time, he decided to donate about 32 hectares of his land to be utilized as the mental institution in the Bicol region. So in 1960, the Don Susano Rodriguez Memorial Mental Hospital was eventually established.
Through the years, the psychiatry department had dynamically responded to the changing times, particularly in terms of services offered, human resources, training and research, infrastructure, equipment, and community involvement. In terms of our services, in 2014, the Psychiatry Department was recognized as an ISO-accredited facility, a status sustained by our center until present time. We are a 200-bed capacity department and with an updated license to operate, duly signed by Dr. Ernie Vera, Director 4, Regional Director, DOH Region 5. In 2022, the Health Facility Development Bureau reported the status of mental health specialty centers in the Philippines, wherein the Bicol Medical Center Department of Psychiatry is already considered as an advanced comprehensive center with a 93.61 functionality score. We serve as an apex or end referral facility at the subnational or regional level, providing an array of services beginning from outpatient consultations to inpatient assessment, neuropsychological testing, therapeutic play, forensic evaluation, detoxification program, home conduction, pharmacy, and laboratory services. Concerning our human resources, our roster of psychiatric consultants have grown bigger with me, Dr. Edessa Legidao, as the department head, Dr. Orville Jespandes as the training officer, and the general and adult psychiatrists are Dr. Olivia Inuturan, Dr. Ana Noel Cortez, and Dr. Froilan A. Geronimo. We also have our forensic psychiatrist, Dr. Lalin Irene Marzan, and the only child and adolescent psychiatrist in the Bicol region, Dr. Elaine Romano. With our consultants being diplomates and fellows of the Philippine Psychiatric Association, in January 2022, we embarked into a new milestone, the establishment of the Psychiatry Residency Program, which, in January 2023, the Psychiatry Department was granted 1-year current and 1-year retro accreditation by the Accreditation Board of the Specialty Board of the Philippine Psychiatry, making our inaugural batch full-fledged second-year residents composed of Dr. Edwin de la Cruz, Dr. Laika Ley Lebiste, Dr. Andre James Renatay, and Dr. Neri Jane Valencia. We currently have 2 first-year residents, Dr. Karen Idaño and also Dr. Pamela Baldon, who was awarded as the champion in the spoken word competition in the recently concluded Philippine Psychiatric Association mid-year convention held at Baguio City. Furthermore, with our current Psychiatry Ward Center Supervisor, Mr. Henry Prestado, and his admin nurse supervisor, Ms. Lindsay Oliver, majority of our nursing staff members have international and local training under the Department of Health and were subsequently granted certification as nurse specialists, psychiatric nurses with globally competitive aptitude and skills in mental health nursing care. In addition, our section of psychology headed by Ms. Elaine Gongora, along with her staff of licensed psychometricians, they administer latest and varied choices of psychological test materials for a comprehensive assessment of one's cognitive ability. For training and research, aside from the residency training program and providing experiential learnings to clerks and interns, the Psychiatry Department doctors and nurses also provide specialized training to external stakeholders who are intending to open their respective acute psychiatric unit. Moreover, both the medical and nursing staff are engaged into research for further improvement of psychiatric management as well as finding strategies on how to alleviate difficulties in performing certain hospital procedures. Relating to infrastructure, in 2015, with then DOH Secretary Enrique T. Ona Jr., the Psychiatry Department was included in the modernization program under the headship of former Medical Center Chief Dr. Efren Nerva. Thereafter, construction took place, and in 2018, the Acute Crisis Intervention Service Building was inaugurated, while in 2019, the male ward and admin building became fully operational. And currently, with ongoing construction and renovation of the female ward under the direct supervision of our Medical Center Chief, Dr. Ronnie Gregor Gigantone III. With regard to equipment, the Psychiatry Department houses the state-of-the-art technology in the management of mental health conditions, the very first in the Philippines, the Deep Transcranial Magnetic Stimulation Machine, which is currently utilized for the management of depression and obsessive-compulsive disorder. Other indications for this somatic therapy are migraine, smoking cessation, post-traumatic stress disorder, chronic pain, and multiple sclerosis. Additionally, doctors and nurses are locally and internationally trained and certified DTMS providers. For community involvement, our consultants are recognized by the World Health Organization as module facilitators and lecturers of the Mental Health Gap Action Program among primary healthcare workers, and duly recognized by DOH Regional Office to train for screening, brief intervention, and referral to treatment and assessment for drug dependency of PWUDs. We likewise conduct psychological first aid among internal and external stakeholders, as well as actively participates in various mental health symposia as seasoned speakers locally and internationally. Despite having all of these current accomplishments, the Department of Psychiatry will still continue to strive for excellence, especially with the full support of our Medical Center Chief, Dr. Ronnie Gregor Gigantone III. You will witness further improvement of our department concerning infrastructure, particularly with the soon-to-commence construction of Phase 2 female ward. For equipment, the purchase of electroconvulsive therapy machine and X-ray machine. For services, establishment of 24-hour pharmacy and satellite laboratory and radiology services, as well as opening of psychiatric daycare center and sleep center. For training and research, connecting with other training institutions via telepsychiatry, maintaining current accredited status of its residency training program, and eventual subspecialty training. For linkages, keeping our partnership with the DOH Regional Office in the training of primary healthcare workers in the Bicol region.
Thank you po.
Ini po
So,
ang Psychiatry
masunod na po yung
Department,
sa kuyang
Diyos
sa
mabalos
lipot
po
na
sa
lang na
Indogabo.
presentation because ang sa kuya pong title ng presentation is is the services and treatment. So, dun po ako mag-focus. Although po na-mention sa bago, duman sa video, yung sa muna na pong services sa tiktatao sa mental hospital. However, matao pa po ako ng emphasis para kung sakali pong may gusto ko mong i-refer sa samuyang hospital, madali na lang po nindong maintindihan. Okay po, so we start po with the presentation. So the title po is Facility-Based Mental Health Services and Treatment. Next slide, sir. So, nahiling po nindo, ay nadangog po nindo, sinabi ni Dr. Pandes, Don Susano Rodriguez Memorial Mental Hospital. Yan po ang pinaka-old na pangaran kasamoyang hospital because of Don Susano Rodriguez who was the donor of our 32-hectare land. Pero 1980s, we were adopted po by Bicol Medical Center, kaya we are also named as the Department of Psychiatry, and recently, because there is changes in nomenclature, we are also known as the Mental Health Center. Pero bottom line, Bicol Medical Center po kami. Okay, next slide. So ako po, again, chairman. Next slide po. My psychiatric consultants, which were enumerated sa bago, saro-saro. So aram na po nindo kung isa dyan ang general and adult psychiatrist. And actually, di man po masakit giromdomon kasi saro-saro man lang po ang child and adolescent psychiatrist me sa Bicol Medical Center, who is Dr. Elaine Romano. Actually, yan siya dyan sa likod. And for our psychiatric residents, sige sir, next slide po. Ayan po, my first year and my second year, and baka po may interested, we are open, inviting po kami for new residents. Actually, we are accepting na po application. For our psychiatric staff, we are composed of nurses, nurse aides, records officers, social workers, and the rest. So actually, pwede na po kami magpadalaga ng saro din hospital. Ano po, kasi kompleto man kami sa staff. Pero, aside from us, kami po psychiatrists, residents, and psychologists, kami lang po talaga ang organic. All the rest po, pwedeng rotate anytime. Sige po. So for our services, this is the meat talaga po ng sakuyang presentation. Sampulo po siya. So we begin po with inpatient. So for the inpatient, our first goal is to provide a safe and holding environment for patients who are assaultive, disruptive, and suicidal. So yun po yung pinakainot. Makatao kami ng safe holding environment for these patients, and thereafter, we initiate management according to updated treatment guidelines. Our second goal is to maximize stay at the acute crisis intervention service unit for 2 weeks. Maximum na po yan. Ano po? Pero napapauli man po earlier than that. So, nadepende pa rin talaga po sa response ng patient. Ano po? Pero maximum stay mi po talaga is 2 weeks. As much as possible po kasi, we avoid maglaog mo na ning natagaluwas sa ward. Ano po? Kasi di ba po, dawa sinasabi na lifted na yung COVID-19 emergency, still iniingatan mi pa rin po si mga nasa laog. Kaya as much as possible, 2 weeks lang po yung samuyang maximum stay at the observation or the ASIS. And then, yan po, dapat may sarong watcher. Dapat nga ni po duwa. Pero pwede na ang saro, basta desidido. And ideally po, 18 to 60 years old ko ta. Ano po? Pero there are relatives na mas young sa 18 and mas old sa 60. So we require them to sign a waiver. Ano po? So next po is our outpatient for adult and outpatient for child and adolescent. So for adults po, Mondays to Fridays, Thursday, court case, accused, and Friday, court case victims. So may special days po kami for court cases. While for child and adolescent cases, Tuesday, regular consultations, while Wednesday is for court case. So ano po yung requirement? Baka mamaya po may gusto ko mong i-refer sa MUYA na court case patients, dapat po may darang referral letter. So kanino manggagaling ang referral letter? From the PAW, the municipal or city social worker, or from the prosecutor. Ano po, dapat may dara siya kayan, and may police blotter, and as much as possible, may social case study na po kuta. Ano po, from the LGU na social service. And however, kung accompanied na po by PNP and BJMP, usually po we require court order. So yan po kaya sinasalaog na. So ini pong 1 to 3, ma-file pa sana. Ano po, ning kaso. Kaya may require po kami ning documents. Ano po. Then for therapeutic play, the main objective of this intervention is to improve the emotional well-being of the child accomplished through the use of play and or the creative arts. So mahiling naman po nindo, ang pwede lang po kayan are children. And actually po, therapeutic play is more efficient to children who underwent trauma and abuse. Ano po? So yan po is a intervention lang na pang-aki. Ano po? Dahil po ang ginigibo sa mga gurang. So for detoxification, we have protocols for alcohol use and alcohol substance disorder. So what do we do when patients are admitted for these purposes? We administer IV and oral medications, and they also stay at the ASIS for 1 to 2 weeks. So while at the ASIS, laboratory tests and psychiatric evaluation are simultaneously done because eventually these patients will be referred to rehab facility of choice. And for the next service, neuropsychiatric, so para saan namin po ito ginagawa? For employment purposes, for promotion, school placement, yan po yung mga SPED. For court cases, for work or school resumption. So ito po, work or school resumption, ito po bagay ito may fitness. Fitness to return to school or to work. Ideally po, we require a certificate or a letter from the doctor who is seeing the patient in the general setting bago po kami mag-taon sa dirimi pong evaluation and medical certificate. So next service is the forensic evaluation from the word itself para po ni sa mga may court case. So ano po yung ginigibo when forensic evaluation is done? May interview mo na, then psychological testing and interview with collateral informants. Kaya dapat po, pag maduman, because of forensic purposes, may kaiba. Ano po, dapat po may collateral informant para nako-confirm yung information na binigay ng patient. So ito pong forensic evaluation requires 3 visits. So hindi po yan pagpunta nyo, makukuha nyo agad yung psychiatric evaluation. Dapat po, there are 3 visits para ma-determine namin yung consistency of the information or the responses of the patient as well as the collateral informant. So number 6 is the home conduction. So para saan po ito? Sa mga long-staying patients. Ano po, marami po kasi kami doon sa loob. So ang nagpe-prepare po niyan is our social worker wherein nilolocate yung mga relatives ng pasyenteng ito and patients are given 1 month free supply. Pero with reminder to do OPD follow-up after the consumption of the medications. So number 8 is the outpatient. Outpatient, dapat outpatient pero nakasulat ko, prescription issued also to inpatients. Ano po, dapat outpatients lang. So they proceed to the pharmacy to check for available medications and when there is available medications through the MAP-MH, we give it to the patient pero limited lang po to 1 month para everybody happy. Ano po, kasi pag binigyan namin ng 3 months, kawawa naman yung iba na mangangailangan pa ng supply ng gamot. So for the laboratory and radiology services, yan po yung mga pinaprovide namin kasi pero ito po is actually for inpatients only. Ano po? So yan po yung mga naka-admit, may pumupunta po sa amin na medical technologist and then dinadala po sa BMC yung specimen and doon po binabasa, binabalik na lang sa amin yung results. So again, yung laboratory po and x-ray is for inpatients only. And ang aming pride, nabanggit ko na po kanina doon sa video, ang deep transcranial magnetic stimulation machine. So ito po is a new innovation in the treatment of psychiatric conditions. So ito po is non-invasive. So wala pong ituturok sa inyo. It uses gentle magnetic waves to simulate nerve cell activity in deep areas of the brain. So yan po yung itsura ng TMS. Para lang po kayong nag-hot oil. Nilalagay lang po yan sa ulo. And nakalagay po dito, 4-week acute phase with 5 sessions a week. That is 20 minutes per session. Ano po? And meron ding tinatawag na 8 to 12 week continuation with 2 sessions a week. So para saan po ang TMS? Major depressive disorder, obsessive compulsive disorder, as well as other uses. So the very first po kasi sa Philippines, dahil yung iba na nasa mga private hospitals sa Manila are regular TMS. Ano po? Yung sa amin po is the deep TMS, ibig sabihin, mas wide ang coverage niya. So ang promise po ng deep TMS is to be able to remove the patient to medications kasi may iba po na chronic depressed, patients na would want to discontinue the medication. Ano po? So that's my last slide. Thank you.
Again, thank you very much, Dr. Legazpi, for sharing po the accomplishments and the services of BICOL Medical Center. We are truly grateful to know more about the different types of services, programs, and interventions that BMC offers. We truly acknowledge that Don Susano J. Rodriguez Memorial Mental Hospital is making a real difference in the lives of people with mental health conditions, not only in the province of Camarines Sur, but in the whole Bicol region.
Yes, thank you very much, Dr. Lagidao and DMC. Now let's turn our attention to another remarkable institution dedicated to the well-being of individuals. The Malinao Treatment and Rehabilitation Center, situated in the heart of Malinao, Albay, plays a pivotal role in the support and recovery of those affected by substance use and addiction. Today, to enlighten us about their significant contributions in the field of substance use prevention and treatment, we are privileged to hear from the Medical Center Chief 2 of Malinao Treatment and Rehabilitation Center, Dr. Maria Estrella B. Litam, MBAH, FPPS, FPIDSP. A round of applause, please, for Dr. Litam.
Magandang hapon po sa lahat. Gising pa ba tayo? Very good. We are in the midst of mental health advocates, practitioners, educators, and champion local chief executives. I am really very happy to be here in the presence of Mayor Hamor and our very own Tabaco City Mayor, Mayor Crisel Lagmar. So, salamat po dahil gising pa tayo. Salamat sa pagkakataon na ma-share ko sa ating lahat kung ano ang nangyayari sa Malinao Treatment and Rehabilitation Center. Alam niyo ba kung nasaan ang Malinao TRC? Can you have a raise of hands if you know where it is? Kunti lang. So ipapakilala ka, next slide please. Oh, bakit ganito? Google Map, I have the... Sorry, Dr. Lagitaw, ginawa. Ako hindi ko na siya kakailanganin kasi in-update ko na yung slide. So it is a very regularly shaped 1.3 hectare one that is Malinao TRC. Coming from Naga, you'll pass Biluyon going to Tabaco. So this is the main road going to Tabaco. So we are in Barangay Comun, Malinao, Tabaco. We are very near the Mayon Observatory. Coming from Tabaco, if you pass, nalagpasan mo na si Mayon, nalagpasan mo na kami. Okay? Pero coming from Naga, if you're going to Tabaco, kailangan lagpasan mo si Mayon Observatory. Okay? Sige. We are a 3-hectare lot. Pero if you will see, pano na po kami. Hindi kaya ng pointer. Pano na po yan ng lahat ng buildings. Because we are a 125-bed facility and we cater to both male and female persons who use drugs. Actually, ako ayoko ng persons who use drugs. Kasi I also have maintenance medicine. I am also a person who use drugs. But that's the joke among those who use drugs, no? And ito, 2,000 na punta sa DOH, no? Ang Malinaw TRC. But as of date, I've been with Malinaw TRC. As of date, 1.5 years na po ako dito. We are ISO certified. We are Prime HR accredited. We are PhilHealth accredited. And we already have drawn our 5-year development plan and continue to improve our services. Next slide, please. So our mission, if I may share with you, no, is to provide quality, individualized treatment and rehabilitation services to persons who use drugs and their families. Using evidence-based holistic interventions to transform them into drug-free and productive members of society. So makikita po ninyo na hindi pwedeng si Malinaw TRC lang. But since this talk is about facility-based services, the focus will be what we are providing in the residential treatment department of Malinaw TRC. Next slide, please. But before we go there, allow me to share the challenges, which I think is the same for all of us here in the room. To carry out our mandate, the challenges are the same. For us to be able to cater to our patients and our clients, we need to have mental strength. We have to have health, and not just physical health, but well-being. Gaya nga ng narinig nyo na kanina, there is no health without mental health. And ito po ang mga hashtag na ginagamit namin sa workplace to remind us that we don't have to memorize a lot of things, but you just have to remember Fitness Plus. Anong ibig sabihin ng Fitness Plus? Hindi lang po physical. And then safe workplace, safety, security, and also that you are in a safe environment to voice out what it is you think you need to share. Happy workforce, because of course you know that happy people and happy employees are able to give more. Tama? Agree ba tayo? Parang hindi kayo happy. Kailangan na bang magmerienda? Wag muna. And then of course, we always say work and life, but actually, it's not work and life. It's life balance, whatever it is we're doing. Having said that, next slide, please. These are the mental health services we give. And we don't just look at our patients, we also look at our personnel and rehab practitioners. Because without our case managers, there is no one to carry out what needs to be done with our patients and our clients. So in Malinaw, we have inpatient, we have outpatient, and we also have aftercare. Mahaba po ang gamutan. Pasensya, kailangan habaan. The mental health awareness program is something that is recently crafted, but it is already something that we have been doing. A little this, a little that, a little here, a little there. But the mental health awareness program and activities makes it into one program and one project, no? And this is becoming more, getting more traction, no? Because we have a focal person. So, yan po, focal person. We have team building activities, we have clinical supervision, support group, parang debriefing ng mga caregivers. On our monthly and on a regular and monthly basis, we have sports and Zumba. We have coaching and mentoring, and hindi lang po ito basta coaching and mentoring. Nag-train po kami, kumuha kami ng taong nagtumulong sa amin para maintindihan at maisagawa kung ano ba talaga ang coaching and mentoring. Hindi po ito pagtuturo sa iyo kung anong dapat mong gawin, Pero ang objeto po ng coaching is to improve services, to improve performance. And that is what do you call this, self-directed, and you agree to the outcome you want to see. We have annual medical and dental checkup. We have care of the facility. We approved our special privilege leaves. Our first leaves are vacation leaves. No questions asked. Ang kailangan lang, merong maiwan sa PRC para tuloy-tuloy ang programa. We have drug testing and orientation. We also have started to provide these services outside. So, off-site, ginagawa na rin po namin ito. But when we do this, automatic po na may orientation. Hindi lang siya basta-basta drug testing. Kasabay nun, orientation, kasi kung meron mang mangyari, alam na nila kung anong pwedeng gawin at kung kanino lalapit. We have capacity enhancement training. Because of the things that we need to do, we need to have confidence, and we need to know that our case managers and our practitioners are continuously improving in their craft. And therefore, this training can be professional or can be life skills in nature. And then, of course, we have our program implementation reviews. Pasaningin nyo, kasama ba ang program implementation review sa mental health? Tingin ninyo, konti lang ang tumatango. Ang belief ko po, kasama siya. Because sa dami ng ginagawa namin, sa dami ng pinapagawa, sa dami ng pasyente, how do you know that you're doing the right thing? And how can you have a positive feedback or a feedback that you need to improve on something? And this is where the performance implementation review come into play. We do it as a quarterly thing before our PBUR, which is a performance budget utilization review, and then coupled with our management review. So itong PIR, although it is quarterly, we also have one annual PIR that allows us to now evaluate the whole year and then to plan for the year to come. So, sa dami po ng ginagawa natin, ang kailangan po natin isipin or tandaan, creativity. We are doing the same things, but let us be creative in how we execute them. Okay? Consistency. Dapat same level of energy. Kaya ba natin yon? Kaya kailangan natin alagaan ang ating case workers para maging more happy. For our residents and the patients and families, basic po sa kanilang treatment during the residential treatment period, which is 10 to 12 months of stay in the facility, is psychoeducation sessions. We have cognitive behavioral therapy sessions. So very mental, no, very practical, very addressing their issues and their concerns. We have, among the cognitive behavioral therapy sessions, ang talagang blockbuster dyan is anger management and their triggers. Sa tingin ko, kahit sino dito sa atin, mukhang magagamit natin tong anger management at saka addressing triggers. Ano po ba? And then, of course, we have counseling sessions, one-on-one, and family dialogue. So, labor intensive, no? Case worker, case manager intensive. We have education and livelihood programs. Nagsisimula na po kami sa loob ng facility. Kaya natutuwa ako na naririnig ko sa ating mga local chief executives na ganun din. Katuon at katutok sila sa ating community. We have, among the life skill seminars that we saw our patients really needed and our family really needed were family support, effective parenting, and financial literacy. We have the same challenge in the sense that for every 10 PWOD or recovering drug dependent na ni-invite namin to come over for the trainings, even if it is going to be very beneficial to them, only about 3 of the 10 PWOODs would have their family with them. And so we want to see this number and proportion or ratio increase in the coming months and years. We have spiritual activities. We have sports, Zumba, movie, and music time. Music talaga, napaka-importante talaga, no? Para sa relaxation and peace of mind. Mental health seminar, meron na rin po sila, and exit interviews. Dito po sa exit interview, ako po mismo ang gumagawa nito. And this is to find out exactly how good we were in providing the services they needed, or if there was anything else they think should be improved, or if they have any comments whatsoever. Dito po siya pumapasok. So nakikita namin right away what needs to be improved upon. May feedback. We also provide our student-related learning experience for nurses, for psychology students, and also for social welfare students. So madami na rin pong estudyante pumupunta, pero kailangan may numero lang kasi we can only accommodate up to 10 per session. Okay, for in pictures, allow me to show so that you can have a more graphic picture of what's going on. So ito po yung annual medical check-up. We only have 3 medical doctors. Ako po yung pang-apat. We have 8 nurses, 1 dentist, 2 nutritionists, dietitian, and we have an existing MOA with BRTTH and 1 upcoming with BMC for medical diagnostics. Not only for our residents, but also for our employees. We have this psychological safety in the workplace. This is the whole staff of MTRC having fun, relieving stresses, just talking and enjoying each other's company. And this is mental health, particularly to encourage social interaction, raise awareness, and healthy ways of coping about daily stress. This is our clinical supervisory support group led by our very own CHPO, bago ako magkamali, si Sir John Concepcion, right there. So this is creating safe space also and environment to build emotional support for our case managers and our personnel. Our psychoeducational sessions are interactive for patients and family members. To give accurate information on addiction, recovery, treatment, and even interpersonal dynamics. We have therapeutic activities as previously mentioned, anger management, group sessions on cognitive behavioral therapy, and seeking safety. Counseling is also one-on-one or one with the family. And we also give basic counseling sessions or skills, tapos na po. Usually for students. Our way forward. I am happy to note that together with everyone in MTRC, we are one on board. We are looking at one strong family program for the residential treatment department, outpatient, and the aftercare, championed by the families themselves, LGUs, DSWD, TESDA, DepEd, DOH, and sana all of society. Kasi nakita ninyo, hindi ito pwede kung MTRC lamang. Kaya very encouraged po ako personally to hear from our 2 lady executives, local chief executives about what is happening in their places. That is, above there is for our patients. Below here is for our employees. So, dahil may mandato si DOH, pero hindi namin yon tinetake per se, we have bawat empleyado, ramdam ang kalusugan program. We have only 4 items, and this is going to be carried out on a quarterly basis. It will target green environment and everything about it. Getting healthy my way, because ang dami ng healthy programs, it does not work. Look at me, I think it's not working. But we will get there. And then communication. It will start off with writing business letters, And then, of course, financial literacy. So, you know, very, very active, very creative with the help of Dr. Baloloy over there. This group of people started heightened awareness for emotional safety and stress management in the workplace, uh, strategies for managing stress and promoting emotional well-being. Ito, nakakatapos pa lang nila, pero i-roll out pa lang paunti-unti. Gaya nga ng sabi, hindi one time, big time, pero paunti-unti para magkaroon ng traction. So we are Malinaw TRC. This is our city number if you need to call us for referrals or information you might want to have. Our email address, and we are also in FB, Malinaw Treatment and Rehabilitation Center. Our business is breaking addictions, transforming lives. Malinaw na bukas, one day at a time. Maraming salamat. Our sincerest gratitude to Dr. Lutam for providing us with a comprehensive overview of the Malinaw Treatment and Rehabilitation Center. Your dedication to sharing this information is deeply appreciated as it enhances our collective understanding of the significant strides made in treatment and rehabilitation. Thank you very much, Doctora, for your valuable contribution to our program.
And now, at this juncture, we progress through our program. We arrive at the third part called Benchmarking Mental Health and Well-Being in Other Settings. In this section, we will explore innovative approaches and perspective, drawing inspiration and insights from diverse settings that have made remarkable strides in the field of mental health. It's a moment of collaboration, shared learning, and envisioning a brighter future for mental health care. So without further ado, let's embark on this enlightening journey together.
And to introduce our next resource speaker, he is the Principal 2 of San Jose National High School, Malilipot, Albay. Let us all welcome Mr. Buen Owok Owok.
Thank you so much, Ma'am and Sir. To the beautiful and very active Lady Chief Executive, Ma'am Amor of Sorsogon City, my partner with our program, Mayor K, at your service, none other than the beautiful Mayor of Tabaco City, Mayor Crisel Lagman. I would like to salute all the frontliners during the COVID-19 pandemic. When I received the invitation, I ignored it for so many times because I am new in this station, San Jose National High School, almost a year. But I talked to our licensed guidance counselor if what can we share in this particular gatherings. So he told me that San Jose National High School have been doing, serving their students for so long a time, but it was set aside when pandemic struck the locality or the whole world. So maybe some of you have already idea the kind of services the school can give, especially on mental health support and services. San Jose National High School is in the first district of Albay. Fourth big school from Tiwi, Malinaw, Palilipot, Bakakay, Santo Domingo, setting aside Tabaco City because they have their own division office. So we are under the division office SDO Albay. Before I proceed, let me acknowledge the friend, my friend from DepEd Bicol, Dr. Boots Maninang. Where are you, ma'am? I want to get strength from this very strong lady. Every time we had our conferences, she is always there trying to, give us courage, especially in sharing our practices. So, doctors, health workers, you know that before we give solutions, before we give prescription, we have to first diagnose. But in the case of our school, we first identified the common problems in our school that the students are, involved. Not only that they are a victim, but they are perpetrators. So what are the common problems actually that we could experience in the school setting? One, absenteeism and tardiness. Absenteeism because based from our data, they are being used by their parents to work for a living. And tardiness because when they are exhausted, they are not, hindi sila, parang wala sa sarili nila na mag-attend ng klase because they are tired. So kung dumating man sa school, wala na. Tapos na yung first period. Another, bullying. There are 3 identified reasons of bullying. One, they want to show power among their group or peers. Number 2, they want to be known in their group, meaning TSP, kulang sa pansin. And lastly, they want to get something. Number 3 problem is academic stress. Because, they are not ready to attend classes. So, most of the time, they are physically present but mentally absent. And what they did, while inside the classroom, gumagawa ng mga bagay na nakakadistorbo sa iba. Next is teenage pregnancy. Yung teenage pregnancy namin, medyo marami-rami siya. But what we did is still allow them to continue their schooling by providing alternative delivery mode. We did not allow them to attend classes na buntis. Baka sabihin nila, kaya pinapayagang pumasok kasi yung nakabuntis, si sir o kung hindi, yung principal. Ano? Hindi, joke only. So we still allow them to finish their schooling by providing alternative delivery modality. Mayroon pang isang hindi pumasok sa isip ko, sir. Pakilagay nga. Sige, sir. Sige. Continue. Ay, itong gender issues. Yung mga bata ngayon, gusto talagang maglagnat, humihingi ng permiso sa opisina kung pwede silang magdamit ng sa babae, yung mga lalaki. Well, we recognize your rights as LGBTQ, but you have also to respect the rules and regulations of the school. So part na muna yung gusto ninyo, sumunod na lang muna kayo sa kung ano ang nakasulat. So we face a lot of challenges in dealing with the problematic students. But when we conducted home visitation, we learned that all of the students involved in this particular situation are suffering from poverty. Pagtios that is beyond our control. So what have we done so far? Ano ba yung ginawa namin? We employed 4 A's strategies. 1, awareness. 2, advocacy. 3, activity. And 4, assessment or evaluation. Under awareness, we have first to equip ourselves of the laws existing, especially Republic Act 11036 or the mental health law. When I was able to read that particular law, I issued a school memorandum to that effect. Basahin ko lang yung memo. Titulo lang. School Memorandum Number 6, 2022, Promotion and Protection of Mental Health and Psychosocial Well-Being in School and Learning Environment. So at least, just for the start, as we try to embrace the very purpose of the law, and so I issued this particular memorandum. And we conducted 1, psychosocial first aid. First to our teachers so that they could do it for themselves. And then we do it to the SSG officers. So meaning, up to the extent that we organize the peer counselor organization that our student will tell you after my talk about the importance of this particular organization. So that is on awareness. When it comes to advocacy, we tried to involve the community by first attending 2 regular sessions of the barangay council. To your catch-up area. In the case of San Jose National High School, we are covering Calbayog, San Roque, San Jose, Hindi, Sugod, San Francisco. So we requested permission from the Sangguniang Barangay to allow us to sit in and talk about our program on mental health. And we are lucky because they are very supportive. Next. To continue, we crafted 2 very important programs approved by the division office. Tingnan mo nga, sir, kung nandyan. Please, move forward. Ay, uni pala. Number 1, this activity or program was already approved by the division office. 1, the title of the activity, school-based psychosocial first aid and training workshop to improve and conduct mental health and psychosocial well-being of employees in the workplace. That is number one. Number two, and this is the current Project Protect. Parents' rule in teens education for community transformation. So these two programs of the school under mental health are ongoing. And we do not have yet data to whether or not these are effective. And that is why we are conducting research, gathering all the data so that we can make a narratives to be submitted to the division office so that at least they will also give a support on how to continue making this program effective and then give more emphasis not only in the school but also in the community. So about activity, we keep on conducting psychosocial first aid. We use the materials provided by the Department of Education. There is material for the elementary pupils, for secondary pupils, and even for the parents. All we need to do is to access the materials in the available portal of the Department of Education. So if you want to be updated of all the programs of the Department of Education, especially for this particular problem, you have to look for access. One portal is the Disaster Risk Reduction and Management System, DRRMS, wherein updates about the activities are there, posted, updated monthly, sometimes weekly. So all you need to do is to become resourceful. So after that, for us to be able to get the support of the majority of our cuts up area, and so that they will understand that we really mean business, we again launch an an easy access for the students to get connected to our licensed guidance counselor. We posted a QR code to all the classrooms that if the student has a problem and he or she wants to talk with our guidance counselor, all they need to do is to scan the QR code. So I hope I share something. I know this is not perfect. I know this is a project on progress that maybe you can also help us in the Department of Education, especially the school who were devastated extremely by Typhoon Rolly, that until now we are not yet recovered. Lucky the people in Tabaco City because the good mayor have 300 million just to support, repair, and then construct a typhoon-proof school building. But what about us poor? Although we have a very effective guidance center or guidance program, but the center that we are using, dilapidated na. Pag nag-uran, mauran man siya. Pero sabi sa kuya, sir, nagtagdo man sana yan kung nag-uran. Pag dahil naman kiuran, init naman ang nagdaog. But we are actually asking you that if possible, especially the chief executive, please put premium on education. We have to capacitate our people if we want to see to it that we will be having a progressive and peaceful community. Thank you very much and mabuhay.
Thank you very much, Principal Owog Owog. It is truly admirable to see a school administrator being open to ensuring the holistic well-being of his students. San Jose National High School is indeed very lucky to have you, sir. And from Principal Owog Owog's talk, we all know that adolescent peer support plays a pivotal role in creating a supportive environment for adolescents to navigate the complexities of their mental health and personal development. It fosters understanding, resilience, and empowers young individuals to lead healthier, more fulfilling lives. Please join us in welcoming a passionate advocate who will share her expertise and insights on the importance of adolescent peer support and its transformative impact on young lives. Let us give a warm welcome to Ms. Cyrene May P. Isa. A round of applause, please.
So, good afternoon, everyone. I won't start with the usual. Good afternoon, everyone. My name is Irene kasi it's cliche na po. So, a few weeks ago, our guidance counselor, Mrs. Marta C. Basilia, messaged me about today's presentation. We had almost little time to prepare for the presentation, but luckily we made things through despite such short notice. So, actually, I'm very nervous right now since this is my first time speaking at such large crowd and in a formal event. But today, I prepared a short presentation about a very special organization with the title Adolescent Peer Support. It shows the practices, projects, and future plans of the Peer Facilitators Organization of San Jose National High School. Next slide po. Next po. So, what is the Peer Facilitators Organization? Why is it important and why should you listen to this presentation? Well, simply, Peer Facilitators Organization, which was formerly known as the Peer Counselors Organization, is a peer facilitating organization led by the youth and student volunteers of San Jose National High School, which focuses on mental health awareness campaigns and movement programs. And here's a short background about PFO. It was founded by Project Agapay, an innovative project of the Office of the Guidance Counselor. It was founded on 2014 with the help of Team Albay Youth Organization or TAYO. And on 2016, it was a recipient of Bicol University College of Education's Values Education's Community Outreach Program, where we learned that the students and members of this organization are called peer rangers. So, next slide po. So, why was PFO created? PFO was created with the goal to help students realize and understand the importance of mental health care and awareness. With the PFO, we were able to conduct peer counseling activities and programs with the help of peer rangers officers, the support of Sir Buen, and of course with the guidance of Ma'am Tess Basilia. Next slide. So what is the importance of the organization and of the following? Well, PFO is very important in terms of student relationship building and creating a safe space for students. But most of all, PFO is the main contributor and driver of the school's mental health related programs, which ensures the students that they are not alone in this journey and even in their own little battles. Mental health is a very important matter or topic because aside from it is often misunderstood and taken carelessly by others, mental health includes our emotional, psychological, and social well-being, wherein if not taken good care of, a person might end up extremely depressed and more underlying problems may come in. The projects and activities of the organization alone has helped many students and the school as well. This has helped in shaping them and motivating them into sharing their problems and helping themselves out. The experience, involvement, and skills that they learn by simply being a part of the organization and activities conducted by the organization has helped students to understand mental health and its importance. This has helped in shaping them as individuals as well as learn new skills that are important in their daily lives. Next. So these are the goals and objectives of the organization. Promote mental health awareness and advocate self-care assessment, provide support and counseling services for those in need, foster communication between peers, develop skills in leadership and techniques on how to understand themselves, their feelings, as well as in active listening and understanding. Next. So the following slide shows the notable achievements of the organization. Next slide. Thank you. So this is the virtual youth formation wherein some guest speakers and Mrs. Maritas Basilia oriented the parents about the importance of mental health awareness kasi most students, according to most students, marami sa kanila ang nakaka-experience na hindi sila naiintindihan ng parents nila. So to help parents understand the mental health of matters and kung paano ba talaga i-handle ang mga anak nila, the PFO conducted a virtual orientation to help parents understand kung bakit nga ba nangyayari ito sa mga anak nila, bakit sila nakakadama ng ganito, and why some students often get depressed. Kasi sabi nga po, isa sa mga nare-receive namin na stories or complaints from students is the reason why they feel extremely sad or depressed is dahil lang din sa pressure from parents and mostly hindi sila naiintindihan kung bakit sila nagre-react ng ganong way. So next slide po. Next pa po. So this is Project SML or Project Share Mo Lang by PFO, wherein students will post their feelings on a interactive board located in the guidance office. Meron po kaming prepare na sticky notes kung saan pwedeng isulat ng students yung nafe-feel nila and ipopost nila iyon doon sa interactive board. And if na-notice ng peer rangers officers na parang may something na mali or may student na need ng help or assistance, kakausapin namin sila. And if hindi na kaya ng officers, ipapasa namin yung work to Ma'am Basilia since siya yung mas may alam sa kung paano mag-handle properly ng ano. So next slide po. So this is the Child Protection Forum for Parents, kagaya po ng mention ko earlier. So this is the peers through activity during leadership training. Actually, this was a rush activity. On the spot namin siya inisip. Kinonduct siya right after ng opening ng face-to-face classes a few months after na in-announce na back to face-to-face classes na. Dito, we advise the students to write in a paper kung ano yung mga bagay na nafe-feel nila and i-share nila yun sa amin. Some students shared na grabe yung depression na na-feel nila during nung pandemic kasi wala silang mapag-sharean. Kasi mostly daw ng students, nung nag-share sila sa parents nila, hindi man sila naintindihan because sabi ng parents nila, ay, kuning kaka-cellphone mo lang yan or baka nag-iisip ka lang ng kung ano-ano. Kaya sabi nila, masaya sila na may nakaintindi sa kanila and nakapag-share sila ng problema nila at least sa amin, na-feel nila na safe sila mag-share. So, next slide po. So, org partnership, hindi lang naghahanap po yung organization namin ng iba-ibang partnership upang makatulong sa iba't ibang projects ng PFO. Next slide. So this po is Project Kamustahan. Para po ito sa mga students ng San Jose National High School na may record sa guidance office or sa school na nagka-cutting classes, bullying, and kung ano man, or yung mga students na tinuturing na pasaway. Ito pong Project Kamustahan ay nakatulong siya upang mabawasan ang dropouts ng San Jose National High School. And because of Project Kamustahan, we were able to help those students and understand kung bakit ganun sila mag-behave. Okay, so next slide po. Yan po yung ibang documentations about that. So, Teen Center. The Teen Center, ang main goal namin dyan ay makatulong kami sa mga students na in need and mabago ang negative perception ng students towards sa guidance office. Karamihan po kasi ng students ay pag narinig nila ang guidance office, naisip nila na kapag tinatawag sila sa guidance office, may nagawa silang mali or may kasalanan sila. So with Teen Center, we were able to help those students na in need, na pag need nila ng help, all they have to do is go to the guidance office, talk to us, and matutulungan namin sila sa kung ano man ang need nila. And may prepare din kami na interactive na activities. But unfortunately, during this day, nawala na po yung Teen Center because of kakulangan ng funds and nasira po nung bagyo. Next slide po. Okay, so yan po yung goals ng pagiging Peer Rangers officer. Skip na lang po natin. Next slide po. Next po. Sige po. So these are the future projects for San Jose National High School. Okay. So October with Me. This is an interactive activity dedicated for the celebration of World Health Awareness Month. Unfortunately, due to lack of budget, hindi namin siya na-conduct. Pero this is sana, para po sana ito sa students na makapag-conduct kami ng even short na intervention activities for those students na need ng help. Next po. Kapit Bisig PRO. This is to revive the Teen Center of PRO, which is also na gusto namin i-extend ang help ng San Jose National High School, from school lang to the whole Malilipot, na hindi lang yung students ng school namin, kundi yung mga mamamayan ng Malilipot. So this is Project Protected. So the PRO stands for Peer Rangers Officers. So with the help of this, itatry namin na mag-pass ng proposal sa school na hayaan na at ma-exempt yung students na members of LGBTQ community na makapag-express ng sarili nila through haircut, kasi madaming students ang nagmamakaawa sa amin na for example, may isang student na lumapit sa akin, Ate Sai, pa di ba na kausapin si Sir Buen na at least yung haircut man lamang ma-exempt kami, kasi gusto namin na ma-express yung sarili namin freely and yung kung how we identify ourselves as. So next project po is A Sweat of Hope. Since kulang po ang budget ng PRO, nag-isip po ako ng activity kung saan makaka-generate kami ng funds, kung saan ang kada money na makokollect namin ay gagamitin para sa future projects ng PRO. And also, yung fund run po na ito ay dedicated para sa mga taong nagsasuffer ng depression, na ipakita sa kanila na we support them, that they are not alone. Next po. fear no more. So, instead po of fear, we use fear kasi maraming students ang natatakot na mag-share ng feelings nila kasi takot sila na ma-invalidate sila. So, naisip po namin na aside from the project SML, students will be able to share their feelings through letters na ihuhulog nila sa Dropbox and magsusulat sila na kung anong way and kung anong anong gusto nilang paraan para matulungan namin sila. Next po. Appear tayo. So, another po ito na activity para sa school na makakuha ulit ng funds para sa future projects ng PFO kung saan magpo-provide kami ng paint and students will pay for at least 15 pesos for any color and hahanap kami ng place doon sa guidance office kung saan pwede nila ilagay yung palm nila. Pwede rin nila dito isulat kung ano man yung nafe-feel nila malapit sa kung saan magiging memory na nila ito sa school. So parang markings na they are allies of mental health awareness campaigns. Next slide po. So, embrace yourself. Actually, nauna na po tong plan na naisip namin na bibili na lang kami ng bracelets and ibibenta namin yon. Pero since kulang pa din po sa funds, naisip ko na maghahanap na lang ako ng external stakeholders or partners para na makabili kami ng beads na instead na bibili na lang yung student ng beads, gagawa na lang sila ng beads na it's either ibebenta or bibilhin nila para naman habang gumagawa sila ng bracelet, pwede kami mag-conduct ng intervention programs and activities na kakausapin namin sila or magpapa-activity para hindi naman masyadong ma-stress yung mga bata sa academic and hindi nila ma-feel na ay puro na lang studies, at least ma-feel nila na the guidance office is there. Next po. So, care ka sa akin. So, eto po, leadership training para sa members ng PFO kasi hindi naman po kami makakapag-provide ng help sa kanila if wala kaming knowledge kung paano namin sila tutulungan. So, nag-usap kami ni Ma'am Basilia na gusto namin i-train yung members and yung students or volunteers para makatulong sa kung paanong way i-conduct yung mga activities or projects ng organization. So, thank you po. I'm sorry if hindi maganda yung presentation. Kinakabahan po kasi ako. Thank you po.
Again, thank you very much, Ms. Irene May Bisa, for your presentation. It is truly commendable that there are schools with functional peer support group and also young advocates. So it is truly essential that peer support is a valuable resource for people who are struggling with a variety of issues, including mental health problems, addiction, and life changes. So now to continue with the mental health program and services in the workplace, in today's evolving landscape and significance of mental health programs and services in the workplace cannot be overstated. By supporting mental health in the workplace, employers and employees can create a more productive and supportive work environment. To guide us through this essential conversation, we are honored to have a distinguished speaker who is well versed in this crucial domain. Please join us in extending a warm welcome to our next speaker with years of dedicated experience and a deep commitment to fostering mental well-being. Let us all welcome the Medical Officer 3 of the Juan M. Alberto Memorial District Hospital, Dr. Gibson A. Gabitan.
Good afternoon. Before I go into my presentation, let me just introduce that I am a part of an acute psychiatric unit in Catanduanes, and that's in JNA Hospital in San Andres, Catanduanes. We offer outpatient mental health treatment Monday to Thursday. We also admit patients who are acutely psychotic. So that's 24 hours a day, 7 days a week. And then we offer telehealth consultations also in the afternoon. And then we give community-based mental health treatment every Fridays. Okay, so the topic given to me is actually mental health program and services in the workplace. For our outline, it's quite important for me to deal muna with stress and workplace related stress and burnout because we will be talking about work related stress. No? So we would like to have an institutionalized mental health program for our workers. That's why kailangan muna natin pag-usapan ng saglit ang all about stress. And then pertinent administrative issuances by government in terms of establishing workplace mental health programs. The wellness movement, what is it about? Yun po ang program na ginagawa namin sa aming institution. And then of course, infusing our experience the whole way through. Okay, so according to the Mayo Clinic, next slide. According to the Mayo Clinic, stress is an automatic physical, mental, and emotional response to a challenging event and a normal part of everyday's life. So as a worker, araw-araw po tayo nakakaranas ng stress, no? When channeled positively, stress can lead to growth, action, and change, but negative stress can lessen our quality of life. That is why we have a very nice slide devised by psychologists Robert Yerkes and John Dillingham Dodson. This is a very nice slide, very nice model in correlating work performance with stress. No? So kung makikita natin dito sa part na to, kapag ka masyadong maliit pa lang ang stress sa work, hindi ka masyado inactive ka, hindi ka masyado productive kasi konti lang ang ginagawa mo. And as you go along, habang dito po sa axis na to, ito po yung stress level, dito naman po yung performance, no? Performance achievement. So habang dumadami ang stress, habang dumadami ang challenges mo sa work, you get to reach a point where your performance is at the optimum, no? However, there will come a point in time when you will experience fatigue. Pagka sobra-sobra ng dami ng stress natin sa trabaho, no? I think everyone can relate. And then after that, pagka sobra-sobra ng stress, naturally performance will tend to go down. No? So that's the Yerkes-Dodson law. Basically, it says that a certain amount of stress is good for us. It helps us improve performance. However, when stress gets too high, the performance decreases. No? So ito po yung theoretical basis why we really need to establish a very nice mental health program in our workplaces. So the National Institute of Health classifies stress into three categories. Or otherwise as eustress. Ito po yung magandang klaseng stress na tolerable pa na kayang-kaya pa natin because it leads to good performance. Which leads us to another kind, which is tolerable stress. Situations where bad things happen, but the individual with healthy brain architecture is able to cope. Often with the support of family, friends, and other individuals. No, ito pa yung kayang-kaya nating stress. So maski may ibigay sa ating additional work sa trabaho, with the support of our friends, our mentors, kaya pa natin mag-produce ng output. No? So this is tolerable stress. Even adverse outcomes can be growth experiences for individuals with such positive adaptive characteristics that promote resilience in the face of adversity. Okay? And also leading us to the third kind of stress, which is toxic stress. Ito na po yung hindi na tayo nakakapag-adapt. And this is the point where we experience fatigue and our performance goes down. No? The three basic keywords are limited support. We have limited support at this point, and because of the effects of adverse early life events, kung ano ang manangyari sa atin in the past, especially when we were growing up, during our formative years, malaki po ang impact. on how to we adapt to stress, no? And then eventually unable na tayo to cope with stress. And this is now toxic, no? And it has a lot of adverse effects on behavior and physiology. So dito na nagkakaroon ng mga mental health problems. Next slide. Okay, so another psychologist, Bonanno, defines resilience as the ability to bounce back quickly in the face of a stressful situation. No, so kailangan ko rin i-mention ang resilience because this is basically the idea why the wellness movement was created. No, ito po yung pag-uusapan natin as our mental health program in the workplace. There are various resilience strategies. Actually, meron ng 12S ang DOH eh. However, these are five resilience strategies that will become important in our discussion of mental health program in the workplace. So, una po is calm thinking, which is taking deep breaths during work breaks, grounding and meditation exercises. Kailangan ko lang itong munang i-mention because ito po yung ating mga magiging basis ng mga tools na ipapakita ko later on. Ano? And then another strategy is connectedness. Participating in a check-in session with colleagues. So yung colleagues mo nakukumusta sa'yo. So ganun lang basically ang connectedness. Ano? Lahat ng mga miyembro ng organization na yun, they are connected somehow and they ask kumusta ka na, kung ano ang ginagawa mo. Ano? You uplift each other. No? Sending appreciation and commendations on your team members. And then sense of hope. So before we go to work, we try to pray before and after our shifts, no? And then next slide. Another would be sense of safety, wearing of appropriate PPEs before entering the hospital, eating on time, and getting enough sleep. So basically safety sa ating physical health. And then finally, empowerment. When we see consultations for our supervisors to discuss our concerns. No? So we voice out our concerns. So that is sense of empowerment. When we talk about establishing workplace mental health program, it was basically said during within the entirety of the Republic Act 11036 or the Mental Health Act. And the Mental Health Act give power to the Civil Service Commission and in order to give guidance to government employees on how to establish their mental health workplace programs. Now, so this is through the CSC Circular 04 series of 2020. So ito po yung ating mga legal basis for the establishment of our mental health programs. Next slide. So what is the wellness movement? The World Health Organization, the Department of Health, as well as the with support from the Australian government, has joined forces to create the wellness movement through Project Brave. Now, so this was a project that was launched early this year, January, and was participated on by three regions: NCR, Region 5, and Region 10. No? So we were fortunate na kasama po tayo sa 3 pilot regions. Next slide. Basically, the mission is wellness. So it aims to increase the well-being of hospital-based workers in addressing stress and achieving mental wellness. So ang focus talaga dito are healthcare workers pa rin. Eventually, the mission wellness will expand to non-healthcare workers. So ang una muna nilang nag-focus are for the for the healthcare professionals because the Project Brave actually sprouted upon post-pandemic kasi during the pandemic, sorry, kasi kailangan talaga ng support ng mga healthcare workers, 'di ba? Kailangan habang nagbibigay ka ng serbisyo sa mga COVID patients, sino ang nagte-take care sa mental health mo? That's why kami na mga trained to check on the mental health of our healthcare workers, ang tawag sa amin super healers. Kasi hini-heal namin yung mga healers, no? So those are one of the concepts na in-introduce sa amin during the Mission Wellness program. Okay, so launching happened in January of 2020 this year, 2023. Doctors, nurses, and other hospital staff group per region are called Wellness Warrior Squad or a community pod. In Region 5, we have 10 hospitals participating. BMC, Bicol Regional General Hospital and Geriatric Medical Center, BRTTH, our hospital, JMA Hospital, Dr. Lorenzo Ziga Memorial District Hospital, Josefina Belmonte Duran Albay Provincial Hospital, Claveria District Hospital, Camarines or TRC Masbate Provincial, and Sorsogon Provincial Hospital. These 10 hospitals are members of the community pod of Region 5. And one community pod is composed of 10 hospitals, like I said, and about 1,000 members. Each of the members of the community pod is required to recruit 100 members. Ang problema po namin, sa aming hospital, 30 plus lang kaming organic employees, tapos job orders na lahat. Hindi kami aabot ng 100 employees. Next slide. That's why we recruited the San Andres RHU to become members of our group. No, we call our wellness warriors as San Andres Wellness Warriors because the municipality of San Andres, ang mga healthcare workers doon are from our hospital and the RHU San Andres. No, so the launching happened in January 10. Online po yun. Participated by 3 regions. So yun po ang pictures. And then more pictures of the launching. Nakita rin nyo na nag-receive din sila ng mga gadgets. No? Ang wellness movement po kasi happened in 2020 when the wellness gadgets were developed. This was during the pandemic. Tapos nagkaroon ng, in 2021, nagkaroon ng expanded wellness gadgets and eventually nag-roll out na in 2022. So the wellness gadgets were received by our staff. So isang box na may mga laman na ipapakita ko sa inyo. These are our hospital staff receiving the wellness gadgets. Next slide. Ano po yung laman? We have comfortable. So parang stress ball siya. Daily breath. Essential stickers. Next slide. TY for today audio guides. Comfort zone stickers and breath body audio guide. So ano-ano po ito, we will discuss one by one. Mental health tools were designed based on target behaviors. So bago ka pumasok ng trabaho, anong ginagawa mo? So pre-duty yon. So you are recommended to do grounding and breathing exercises to help you to start your day. Okay? And while you are doing your job that's on duty, you are recommended to do decompression and relaxation behaviors. All right? And then post-duty behaviors and also deep breathing to help you relieve the stress na nakuha mo buong araw. No? So daily breath. At the start of the day, araw-araw tayo hawak cellphone agad-agad, di ba? Paggising sa umaga. At the start of the day, may magpapadala na sa amin ng text message. No? So at the start of the day, ako kasi nakaka-receive ko mga around 6 a.m. Mga 6:30. Ganon, may mag-message na sa inyo, reminding or teaching the healthcare workers various methods to practice deep breathing. Iba-iba po yan araw-araw. No? Hindi lang pala at the end of the day, even after office hours, nag-sending sila. So these are the examples of the daily text messages that we receive. And also, doon naman, yung sa GC na namin, sa San Andres Healthcare Workers, at San Andres Wellness Warriors, after kasi ng program, kinontinue na namin siya, of course. Kasi kumbaga, wala na kaming matatanggap na text message kasi may bayad yata yun. So sa GC na namin, pinapadala lahat ng mga morning messages of deep breathing. Next would be breath body. These are deep breathing audio guides posted near beds, o mga beds hindi beds, work areas or pahingahan spaces to help individual decompress after a long day or during lunch breaks. In our hospital, we do breath body during our lunch breaks. Meron kaming pahingahan session, pahingahan spaces pala. It's a small space we designated na pwedeng puntahan ng mga workers during lunch breaks para gusto lang nila mag-relax. No? So, may soft music, merong audio guides na nakalagay, which they can, may mga QR code po yan, and then you can just play it sa YouTube po yun. Kailangan lang talaga ng internet connection. So, merong mag-guide po sa inyo kung paano to do relaxation. No? So, yun po ang aning breath body. So, these are just examples of our staff. Mga RHU personnel naman po yun, ito mga hospital staff. Next slide. Comfortable. A tension release ball that comes with a guide that can be followed to do progressive muscle relaxation by squeezing and releasing the ball. So ganun lang kasimple. You can actually use this even while working. Next slide. So this is my chief of hospital when she received her tool, her kit, and our hemodialysis staff. Next slide. Ito naman during sa kitchen habang ano sila ng malunggay o di ba meron silang ano, and then a few of the pictures from RH2 habang nagvo-vaccinate or yung during the rollout ng PhilPen risk assessment. Okay, so every day iba-iba po ang style ng pag-squeeze ng ball. Na for example, during Friday parang pag ganyan na ano. So meron kasing guide na sinusundan yung kada employee kung anong gagawin. Gagawin niya sa ball depending sa day. No? So you can use it all throughout the day na nagtatrabaho ka. And even when you go home, during Saturdays and Sundays, meron din pong process kung paano ginagamit. No? Next slide. Essential stickers. These are stickers that you can put in your clothes. No? A set of stickers infused with scents that can improve your mood. They can offer much needed relief, especially on busy days with their relaxing scent. So iba-ibang scent, pinakagusto ko dyan yung lavender. No? Next, ayan po mga pictures. So you can put it, yung madali yung maamoy, no? Kasi everyday, buong araw siya. Ako hinahati ko kasi hanggang ngayon po, hindi namin alam kung saan bibili ng susunod na stock. Kaya tinitipid ko siya. Pero kaya meron pa akong tira sa akin kasi iba-ibang scent yun. So, ang iba, kung saan mo madaling maamoy, ilalagay mo lang siya doon. Meron namang iba na nilagay na sa electric fan nila para all throughout the work na amoy nila. So it can actually relax you. And then TY for today, these are audio guides also na you can use during na after post duty na. This is gratitude, giving gratitude to anything, no? A playlist of videos teaching you how to feel or express and experience gratitude even when life gets difficult. No, sa mga GC namin every day may nagbibigay ng reminders to do gratitude, no? So ito po yung example ng mga messages sa GC namin that would encourage the members of our GC, the wellness warriors, to do gratitude listening, no? And then finally, comfort zone stickers for the group chat. These are a set of stickers which you can use. Ito yung ang concept nito is yung kumustahan. Kumustahan sa mga colleagues, giving encouragement, which you can post anytime. During, maski habang nagtatrabaho, you can post sa GC ng mga stickers. No? In the chat groups, these stickers are used to check up. Ito yung mga example po. Believe it or not, si Chris Aquino kasama sa comfort zone stickers. Nakakaloka yung mga ganun. No? So, parang funny and some of them are actually encouraging. Some of them are asking questions to elicit conversation among the healthcare workers. No, so doon lang sa GC namin bawal lang mag-post ng mga binebenta, bawal magpa-like kasi may padamihan ng like sa mga beauty pageant, sa mga ganun. May mga bawal lang sa GC. All we can post sa GC are encouragements, mga good morning messages, good evening, gratitude, all those things to help us with our mental health, no? And then in summary, it is an essential part of personal care to manage stress so that our productivity at work will not falter. While we may individually do self-care methods that effectively work for us, it is also important that work institutions must establish a wellness program that enables to manage and follow up on its workers. Thank you.
All right, thank you po, Dr. Gabitan. I think I speak for everyone when I say that a mental health program in the workplace is a great help to us workers. Not only will it promote holistic health for us workers, but it may also act as a motivator to improve performance. And thank you very much for providing us a template that we can that we might be able to follow if we can implement it in our own workplaces as well. Now we are about to embark on a discussion of utmost significance. centered around Bicol mental health milestones and the ways to universal healthcare. To guide us through this insightful journey, we have the privilege of introducing a seasoned program manager who is involved in mental health program and substance use prevention program, health and wellness program for persons with disabilities, and prevention of blindness program, all underneath the umbrella of the non-communicable diseases prevention and control cluster in the Department of Health Center for Health Development, BICOL. Her dedication and expertise have played a pivotal role in advancing mental health initiatives in our region. Without further ado, let us give a warm welcome to Ms. Wendolyn G. Baluis, RN, MN. A round of applause, please.
And thank you so much. Magandang hapon po sa lahat. Okay pa po ba? On your left, pakitanong po, okay ka pa po ba? Okay pa? On your right, pakitanong, okay pa po ba? Giniginaw na. Nako. But you're so blessed because we will be offering you a lot of options in our program direction. Kaya yung mga nandito pa, napakalinaw kung ano po yung dapat nating tatahakin. Sabi nga, all together we can do a difference, no? We would like to expect a lot of changes in the implementation of our respective mandates. So with that, allow me to share with you our journey in the Department of Health with the help of our support or in collaboration with our Bicol Council for Mental Health. Next slide, please. Ayan. So tingnan po natin itong apat na napaka-importanteng questions, no? Starting from the where have we been? Where are we now? Where do we want to go? And how do we go? How do we want to get to our goal, no? So with that, I would like again to bring you back to where have we been. In 2010, I don't know if you will still remember for the season program coordinators, I think it's really our difficulties and hardship to implement our programs because there are a lot of limitations or restrictions when it comes to the policies. But that was not a restrictions in Bicol region. Why? With existing policies only, the DOH-AO 2001. So, meaning to say in 2001, we have already a policy. Pero wala pa po si Mental Health Act. Hindi pa ipinanganak, no? And with that, we have also this opportunity to walk through with our DOH-AO, so administrative order, and that was in 2007. So entitled the Operational Framework for the Sustainable Establishment of the Mental Health Program. So we are aiming that with our vision, mental health and well-being for all Filipino, we will be able to walk them, no, to our goal to have a value promoting, protecting the basic right of all Filipinos to mental health and well-being. And of course, to provide comprehensive, comprehensive, integrated, accessible, and quality mental health programs and services. So that was indeed translated by the passage of the National Mental Health Law, which is the Republic Act 11036. So all of the key partners were clearly defined the roles and responsibilities. Lahat po yan. Based from our pyramid of intervention, starting from the community to the support and even to our professionals up to the health facilities or specialized facilities, it was all defined, including our stakeholders. Okay. So I would like again to walk you through that there are a lot of dynamics in our policy. In fact, 2020, we already developed the mental health in the workplace. We just align that to the CSU mandate. So the CSC, the Commission on Civil Service Commission, issued the mental health in the workplace. So meron po tayong prototype na model wherein a lot of our agencies, if we want to institutionalize the mental health in the workplace, TSC has a lot of policy that we can adapt, no? Together with the Department of Health, we also disseminate that, and I think a very good practice that has already institutionalized the mental health is the Juan Alberto Memorial District Hospital. Palakpakan po natin. And not to mention, a lot of agencies also are doing that. And that's the reason why we crafted the criteria for all the champions in the implementation of our mental health in the place. So tingnan natin yun. Baka isa po tayo doon sa mga nag-a-adhere sa ating mental health in the workplace. And not to mention, we also established the USAP tayo. At mas lalo po kayong ma-excite mamaya because this is one of the innovations created in the health system, especially in the Bicol region. We established the USAP tayo because we want to bridge, no? We want to access, especially those service users na hindi nila alam kung paano. Magugulat po kayo, no, sa result ng kanilang mga sagot, no, yung findings po. So nagkaroon din po tayo ng opportunity to cascade the creation of our mental health psychosocial support, and this was cascaded indeed to all the provinces because we know that Bicol region is vulnerable when it comes to emergency situation, right? But the question, are we prepared, okay, to offer mental health and psychosocial support services to our service users? Maybe you are experiencing no, a lot of this emergency situation, especially during insurgency related. Paano ba natin i-address ito, no? Okay, distressful event and other situations that may affect the mental health of our service user or population. And again, we also would like to give you an information that for now, the DOH is on the progress of establishing the internal review board. So ano ba ang objective nitong IRB? The objective of this internal review board is to look into how the human right is being implemented. Kasi baka may mga violations na yan. Huh? So starting from the advanced comprehensive care, so we are very lucky that we have in Bicol region, the Bicol Medical Center Department of Psychiatry, which is one of the advanced comprehensive care facilities in the Philippines. O di ba palakpakan po natin yung Bicol region, another opportunity na wala po sa iba, no? Marami pala tayong mga opportunities. Kailangan lang pong tingnan yung mga information, and the council, the Congress is offering you a lot of information. We just have to listen with the significant information. So and so on and so forth. The medicine access programs are the ones who are addressing in terms of providing the free commodities. If you have you heard about the psychotropic drugs? So this is one of the support being provided by the Department of Health so that all service users, including patients, can access medicines for free. Okay? So another significant information, because our doctors from the primary health care comprised of rural health units, city health offices, the district hospitals were already trained on the MHCAP. So this is the solution to the scarcity of our psychiatrists, that we can bring or offer the mental health services closer to the community. Okay, so we need to align that, especially to the level of our intervention, because we know the fact that we have this scarcity. No? So kaya kailangan nagko-complement. So we have this a lot of doctors already trained on mental health gap action program. Kaya po sila ay handa upang mag-assess at mag-diagnose ng mga patients na dinadala po sa ating primary care level here. Okay, so not to mention also that they were also trained on the screening, brief intervention, okay, referral and treatment. So we are focusing also to the intervention that should be provided to the persons who use drugs. So for now, we're talking about harmonization so that we can give you all the information paano ba namin itutulay itong mga serbisyo na ito with our existing health service provider network. Okay. So we also have this opportunity by issuing the guidelines, so the ethical and responsible reporting and portrayal of suicide in the media. I believe this is also one of the issues being encountered, especially at school, the posting of untoward yung mga pictures and names and details, so this should not be done, no? So kaya hinimo po namin yung aming mga media professionals to help us, no, in battling or fighting against this hindi ka nais-nais na pagpo-post. And I think the role also of our the academe, the teachers, no, is also very significant in terms of how we can also monitor the way, especially the parents, no, the way they are behaving on social media. Alam natin nakakatulong, yun pala hindi. Okay, so it is an evidence-based when we post this very unacceptable behavior. Hindi po siya nakakatulong, no? Because it will indeed, maybe it will trigger, especially the ones who are already experiencing mental health problem. And then, of course, the Republic Act. Next slide, please. Okay, so just to give you a brief, okay, kasi wala tayong idea on how to estimate eh. If we have 300 people here inside the hall, so that means that 10% of us here have mental disorder. Hindi lang natin alam. Baka katabi nyo, palikod nyo, kaharap nyo, on your left. But that was a very acceptable estimation based on the WHO. So with that challenge, we want to think about how can we address this huge number if we have a lot of gaps when it comes to providing our services. So anong dapat gawin? Next slide, please. Okay, so you can see this is the numbers in Bicol region. We are still far from the reality because still we need to strengthen that. And thank you, Dr. Lita. In fact, this is one of the recommendations that we saw in the implementation to strengthen the data management. We will call all the attentions of our LGUs to help us to review the numbers. But for now, we have already 30,854 numbers. But we need to look into the details or the conditions to be able to provide more appropriate or tailored fit intervention because we do not want to waste our resources. So still a lot of arrangement has to be done, especially with our partners in mental health. Okay, next slide please. Yan. So yan po yung ating kailangan pong patunguhan. So we want to look at that our people should have a mental health and well-being na binavalue po siya, promoted and protected. Mental health conditions are identified and treated and prevented that can also be addressed at the primary health care to referral. For our information, we already established our acute psychiatric in Bicol region. So what would be the role of the DOH that? So we help them to establish by supporting them to have a financial support and capacity building. In Bicol region, I'm actually preempting my discussion, but for the purpose of yung momentum. In Bicol region, out of the 6 provinces, one Alberto Memorial District Hospital is one of the champions as an acute psychiatric unit. No, they started a very active and functional acute psychiatric unit wherein they can already manage to handle all the service users, the patients. No, kaunti na lang po yung nire-refer because they can manage to handle, to manage. Okay, So next slide, please. Okay, so next slide. So I would like to walk you through to our milestone. Hindi ko kayang basahin, marami na po, but we just would like to give you an impression that the DOH together with the council are doing hard to address all the issues. What we want now is to work together, talk about the issues and concern, talk about how can we help and contribute to the attainment of our goal. This is the very essence of the Bicol Congress. No? Kaya we're so happy uh, our partners here inside the hall are very active in sharing your concerns. I believe this is very significant because we cannot provide you a customized intervention without listening to your concerns. Okay. So in 2023, nandito na po kami sa kailangan sin-certify na lahat yung mga community-based rehabilitation facilities program. Why? Okay, so mapapansin niyo po, even PWOOD, no, and the mentally ill, the facilities are offering complete package of treatment, even at the primary healthcare. But what is lacking? Once they are already completely treated, of course they will be returned to the family and community. Kaya lang, kung hindi pa po handa yung ating community for the reintegration and there is an absence of aftercare program, chances are they will relapse. Tama, di ba? So, ano po yung aming apela? So, we need to fill the blank. We need to fill the gap. So, we want to empower everyone, especially at the community, to identify, recognize your potentials and partners. Because we believe in every localities you have your champions. Alamin nyo lang po kung sino sila. Pag-usapan nyo lang po kung paano nyo i-address yung inyong mga problema. Lahat po ay may mga opportunities, lahat po may strengths. Kung may weakness man po tayo sa bawat isa, let us complement each other by identifying the strengths and opportunities of your partners. I think this is the best, and that is why the Congress is very successful because we have partners, the discipline, the multidisciplines who are very generous to provide us the directions. Okay, next slide, please. Yan. So with that, those are the members, our partners. Marami na po yan. From 10, it went up to 30 members. And we hope that this will be cascaded in the LGU para meron po kayong platform na pag-usapan anong gusto nating gawin, no, sa ating mental health, sa substance use prevention, ano yung dapat nating gawin. Okay? So start with that alliance. Okay? Next slide, please. Okay. So because we want to go there, this is one of the 8-point agenda of the Department of Health. Magkaroon po tayo ng ginhawa ng isip at damdamin. But how we would like to translate that? I think we need to strengthen our health service providers network in our respective area. So that's how we can start looking your own champions. Next slide, please. Okay, so in Bicol region, so those are the existing network that we have. Okay, so I will not elaborate. Part of that I already tackled. But no, in Bicol region, we are very fortunate that we have this opportunity to combine all champions. To translate that, they were already nominated for our Salud Sandugo Award because we want to extend our gratitude and recognition that they are very significant in terms of making a difference to the mental health program. Okay, so next slide. Okay, so tingnan niyo po ito, yung mga na-train, no? So yan po yung mga na-train natin. Marami po yan. Starting for the mental health psychosocial, nandyan po yung bawat province. Tingnan niyo na lang po, no? Isa-isa. Kung sino yung mababa, kung sino yung mataas, I think that will be the basis for your action. No? Okay, next slide. Okay. So yan din po yung ating percentage of the human resources trained on the MHCAT, and you will see in our data that Okay? In terms of the training or capacity, we need to fill in because how can we provide kung wala naman tayo mga training? Okay. So I think this is also one of the criteria that we need to look into our action plan. Next slide, please. This is our hotline, no? Okay, so yan po yung in-establish natin. Hindi pa nag-umpisa yung pandemic, but we already started to talk about that because we keep on listening a lot of clamors and the cries now among our service users. So we developed that, but we are also introducing the crisis hotline from the National Center for Mental Health, and of course the Lusog Isip application created by the Department of Health with in collaboration with the USAID. I think Sir Jim is also part of that with the URC. So embrace all the opportunities because we have this, no? That can help our mental health and well-being. Next slide. So based on that, ito yung very exciting, no? Ito yung result ng ating usap tayo. No, based on our helpline users in Bicol region, no, 65% preferred not to say their age. What else? Largest percentage of those who revealed their age were 22 to 34 years old. So that is 27.27. Mean is 29. 59 are female. Majority of the service users are from Albay, which account for 58.2. I think this is a call for action. Okay? So, ano pa? So, yan po yung mga percentage. But, next slide. Okay? So, makikita natin consolidated concerns from the DOH Helpline. The top 3 concerns, ayan po, inquiry about access to mental health services. So in other, I'm so happy a while ago, Dr. Lagidao is talking about, we have these services, we have this state of the art, we have the primary health care, the doctors are ready, ano pa ang kulang? Okay? So I think this is a call for action for everyone. So we need to relay, we need to connect. Because by connecting, we can relay this very significant information. Huwag po natin baliwalain yung mga ino-offer na mga services. That's how we can get connected. So everyone, all of our stakeholders, from service users, teachers, guidance counselors, doctors, nurses, principals, directors, whatever, regardless of status, we have a very significant role. And that is by relaying the right information, even the media professionals, no, to make use of this information because we want them to access. So it's useless that we have services, but they are not accessing the services. So what is the problem? What is the gap? So I think with our small ways, we can also talk about that. And of course, part of this strategy is the mental health program, advocacy and promotion. But take note, advocacy and promotion is a role of every level, down to the barangay, because we cannot reach our arm from the level to the bottom. So we need to hold our hands to reach this information, and that is our call for action. So you see, when we talk about the increase in mental health, they are asking about psychiatrists because this is the common denominator. If they have a problem, they will access or seek professional help, psychiatrists. But meron pa tayo ibang mga professionals like the psychologists, the doctors from the LGUs and so on. Sa relationship problem, ito lang dalawa ang i-highlight ko. Alam niyo po ba kung bakit? Tingnan niyo ang taas ng problema sa relationship. But the relationship was referring to the family problem. See? Family problem. So we want to review our Republic Act 11036. Kaninong mandate ito? Ano bang platform na kailangan natin ipasok ang programa so that we can address this issue? Okay? Saan po ba natin pwedeng ipasok yan? Yung relationship sa family problem. So everybody has a significant role to put your own program. As I was saying, we can make a difference by establishing or creating our mental health at any establishment, schools, institutions, offices, agencies, community, all of that, we can make or establish our mental health. Pag-usapan lang po natin para po madress yung mga issues ng ating mga service users. Kasi baka iba yung binibigay natin sa mga kailangan nila. So we need to connect that. So this is a very good opportunity to give you all this information so that we can align our intervention that should be integrated as part of our mental health at your respective initiatives. Okay, so next slide, please. Okay, so isip, so I mentioned already that. Next slide. Okay, because we want that the well-being, the coping, no, kailangan, especially at school, every time that we are handling, no, the children, especially during the evacuation center, I think they can no longer embrace the coping. It's different now. The coping are more are on gadgets, no? This is the reality. The report of mom from the National Council for TB is a very factual information. Isa yan sa mga coping. And when we talk about well-being, may apat na kailangan i-balance dyan. Kahulugan sa buhay. Well-being, mental health is associated to understanding what is well-being. Well-being is all about kabutihan. Kabutihan lang, walang sinabing kasamaan sa mental health. Kaya pag tinukoy mo ang well-being, kailangan mahalaga kung ano ang kahulugan, pakikipagkapwa, yung kanyang kakayanan at ang kalooban. So I hope these four important factors in our kagalingan should be empowered, especially for the young, no? Para makita kung ano yung kanilang purpose in prioritizing their activities. Okay, so next slide. Okay, so next slide po. Okay, so just a picture now showing just a few pictures, no? Next slide, please. Okay, trainings, and then call for action advocacy. Next slide, please. So this is our ways forward. Ibig sabihin yan, marami pa po talaga tayong gagawin. No? So from the policy to entice or empower our leaders to put policies if we do not have because we are confused how to start, then we are here. We will help you on how to start. Okay. We have our mandate. This is an opportunity. A lot of mandates we have now. The CSC, the Public Act, the DOH, the DOLE, the OWA, ang dami po, no? And even our professional associations are very vigilant now, no? In looking at how can we help, no? Okay po, yan po. So I will not read one by one, but those are the actions that we will prioritize. And we are sure that those priority activities and strategies would be able to, next slide, please, align to our 8-point agenda. Ito po yung direction ng ating DOH. Tayo po ay nasa number 6, ginhawa ng isip at damdamin. Next slide. So we want to focus on that every Filipino should have the right for well-being, equal quality mental health services. Next slide. Thank you so much for your listening. Mabuhay po kayo. Thank you very much, Ma'am Wendy, for the very insightful presentation on mental health milestones. Your experiences, dedication, and insightful contributions are truly invaluable. You have not only enriched our understanding of mental health, but have also empowered each one of us to make a meaningful impact and be an agent of change. And now, once more, we are now opening the floor for our interactive open forum. This is your chance to engage with our resource persons, ask questions, and contribute your thoughts and ideas on the topics discussed this afternoon. And again, we would like to request our distinguished resource speakers, Dr. Gabitan, Dr. Yitam, Dr. Dagidaw, Mr. Owog Owog, and Miss Bisa and Ma'am Wendy to be on stage po with our moderate and Dr. Jaisel po Calieja. And to be with our moderators, Miss Abigail Del Puerto and Dr. Jim Baloloy to join us once again on stage. Okay, so we're here once more in this portion, no? This morning we had a very engaging Q&A session and we hope we'll have the same. So, maraming salamat po ulit sa ating mga resource speakers, no? For giving us a very informative, enlightening presentation. So, let's open the floor to any inquiries we have. Any questions? Pwede rin feedback, insight. Clear na po sabi ni
Yes.
Doc Alia.
Ayan, okay na yung microphone ko. Okay. So I'd like to invite all the participants to share if you have any questions or if you have any comments or insights you would like to share here in front. Tapos syempre no, Abi, kung sila wala silang tanong, tayo naman yung may tanong.
Also, it should be a dialogue here kasi yung mga speakers mismo nagbabato ng, oh, I wanna know from our LCEs or at least a representative what's happening in the ground, etc. So, sige, meron ba? From this side kaya? Nilalamig?
Wala, o sige. Maybe we can have some questions on our end, ano, Abi?
Start it. Sige. So, actually, from our table, very interesting yung presentation ni Miss Irene, yung little Miss Irene. Ayan. Tapos, sabi namin, parang masarap interviewin yung bata. Sabi namin, saan humuhugot yung bata? Imagine, someone like her talking about an external stakeholder. Wow! So, do you have a mentor? I'm sure you have. Pero what else is your hugot din kaya? Let's begin with you, no? The youngest in the... So, thank you po. Actually, I was motivated by Ma'am Marta C. Basilia, our guidance counselor. So, when I first joined PRO, she asked me to join kasi sabi niya, I am fit for joining the organization. During that time, I was also suffering depression,
because I experienced PTSD after the loss of my father. So this organization has helped me a lot. Na I felt all the struggles that the students are feeling kasi during my journey towards overcoming depression, I had no one to talk to because medyo hindi nila naintindihan yung nafe-feel ko and why I was like that. Kasi sabi nila, lilipas lang yan, ma-overcome mo yan kasi time na daw yun ng father ko. But to me, I really had a hard time, especially na hindi natural yung death ng father ko. So doon, na-motivate ako na I don't want to be weak. I want to show kids of my age and kids na younger sa akin na ma-inspire sila na they can also do it. Na if kaya ko, kaya din nila. I want to show them hope na they are not alone. So starting from that on, even though I parted ways with San Jose National High School, and hindi na ako yung president, I still continued submitting project proposals. And yung, yes po, actually yung mga tig-present ko po kanina na future plans ng PFO, sa akin po yon na idea. And on the spot ko lang yun ginawa after midterms namin sa BU. So ano, yes, sabi kasi nung during leadership training, nung nag-conduct ako ng peers through activity, sabi ng mga bata sa akin, they want to be like me. And dahil sa akin, nakakuha sila ng courage and na-inspire sila na gusto na nila mag-come out sa shell nila. And ngayon, sila na yung nagpapatuloy ng PFO. Kaya sabi ko, I want to give them projects na ipapatuloy na nila na okay lang at kahit hindi na ako yung mag-ano, at least I will still be able to help the school and the children sa community. Thank you po.
Ayan. Thank you. Actually, may follow-up question ako sa iyo, Irene, no? Oo. Parang kakabahan siya lalo nito, no? Hindi kasi lahat ng schools merong peer counseling organization, ano? So, can you tell us ano sa tingin mo yung mga paraan kung saan mas effective ang mga peers kaysa sa aming mga matatanda sa pag immediately address ng mga mental health issues ng mga kabataan?
So, especially now sa Malilipot, gusto ko lang po ito isingit. Yung PFO, gusto namin ni Ma'am Basilia, matagal na namin, a year na namin pinagpaplanuhan na i-extend yung PFO sa whole barangay ng Malilipot na gawing official teen center ang SJNHS of Malilipot na makatulong kami since hindi nga po lahat ng schools ay active na nagpo-promote ng mental health. And thank you kay Sir Bren and Ma'am Basilia na very active naman sa pag-support sa organization. So I think, especially now na most peers ay halos same na rin yung nararanasan nila na halos lahat na super pressured na and nag-experience ng depression, parang sila na rin na lang din yung nakakaintindi. Kaya like me, with the help of this organization and nagko-conduct ng community outreach programs, peers were able to understand the importance of mental health awareness and yung importance ng pag-care sa sarili nila. Kaya sa tingin ko, at this time, awareness ng teens or peers about sa issues underlying sa depression is very important kasi sila din yung makakatulong sa kapwa nila peer kasi they understand kung ano yung pinanggagalingan nila.
Thank you, Serino. So yung peers talaga malaking role para sa kapwa nila peers. Syempre, kaharap mo ngayon maraming mga policy makers, mga implementors. Andito ka ngayon, kaharap sila. Ano ang kailangan mo? Anong kailangan ng mga schools katulad mo para magkaroon ng isang mas ma-enrich pa na isang peer counseling organization?
it feels actually it feels nostalgic to be in front of everyone, especially never did I once thought na attend ako sa ganitong event. I think as of the moment, I need yung organization namin, we need support, not just sa financially. Kailangan namin ng more advocates ng mental health kasi even just by sharing the importance of it, it is already a big change and a big step towards change.
Thank you so much, Terine. O yan, so maraming resource person dito sa audience. Baka gusto niyo maging resource person sa school nila. Thank you so much. Yan. At this point, baka meron ng mga questions or comments from our audience. Yes, ma'am.
Good afternoon again. My apologies. I keep on asking questions because I would want to take this opportunity. I seldom attend such kind of gatherings, so I know we are all agog of going home, but I think my question, I'll not be going to sleep na hindi ko po ito maitatanong because I've learned a lot from our speaker. So I have two questions, one for Dr. Alitam and one for Sir Buen of San Jose. For Dr. Alitam, you've shared with us the best practices of Malinao. And I would say it's very commendable. However, I noticed that the limitation of the best practice of Malinao, it caters only to the patient of the Malinao Drug Rehab, and likewise the internal client of the Malinao, which is the staff. My question now is, there is the limitation of the local government unit in implementing strategies that would somehow help the program. Saan po ba tayo magkakaroon ng collaboration with Malinao, considering that the neighboring LGUs of Malinao is in dire need as well of not only TA, because that is being provided as well by the OH. Saan po ba kami, Doktora, pwedeng makahingi so that you will be able to expand the best practices na nakita namin sa inyo and hindi siya mako-confine within the four walls of the Malinao Drug Rehab? So that's my question for Dr. Litam. I'm very interested, Dr. For Sir Buen, I noticed po that we have initiatives that would cater to the students, and that is under the DepEd. Okay. What I noticed though is there is no local legislation and or policies that would somehow assure or will make us sustain the implementation of the program being implemented by DepEd. Kasi sa presentation po natin, parang wala po akong nakita na local legislation that has been endorsed by the school board so that the best practice of San Jose will not only from now or will not be implemented now, but rather the sustainability of the project. We all know that local legislation, be it in a resolution or an ordinance endorsed by a board, in our case, the school board, can I continue pa? This will, kumbaga, concretize the action of the school. So nasaan po ngayon yung ating initiative towards sustaining the initiatives or the best practices being adopted of San Jose? And sa akin po, parang ang nakikita ko, although it's not a question, but rather, siguro po, I would highly recommend that a local legislation in a form of a resolution or an ordinance be made as well para po matulungan tayo. And doon naman po kay Ma'am, yung ating youngest guest speaker. Okay. I congratulate you from a perspective of a very young little girl. I would call you still little girl. You gave me a very clear perspective of how you are encountering various difficulties and challenges our adolescents are confronted nowadays. I have a little boy. I have only one son. And now I know if it is hard for me as a mother to be a mother to my son with your speech, what I learned is it is also hard for my son to be a son to us. So again, I would say I salute you and I congratulate you. And I do hope that you sustain your advocacy. You are doing a good job, not only for yourself, but for the rest of the adolescent. Again, congratulations.
Maraming salamat, Dr. Tricia, sa iyong tanong. Unang sa lahat, the message or what I shared was limited talaga sa facility-based. Wala doon yung advocacy, wala doon yung technical skills transfer na usually yun ang paraan ng Malinaw TRC, no? Sa pagsagot sa mga pangangailangan ng LGU as far as their community-based rehab is concerned, and those little things that turn out to be the big things that they need, no, in order to roll out their programs for mental health and for community rehab of their patients for mild cases of addiction, drug addiction. If I may share with you, galing lang kami ng Castilla, Sorsogon, because we were encouraged by what is happening there in Castilla, Sorsogon. However, we were more encouraged because we found out that Castilla, Sorsogon started what they are doing by way of and courtesy of Malinaw TRC. So what they are implementing there in their program is something that we help them, no, the previous management and the case managers and resource speakers from Malinaw TRC, no, was able to do in Castilla, Sorsogon. We have been to as far as Masbate, no, naikot namin ang Masbate, and yun po ang ginagawa naming pagpapakilala. Kaya kung titignan mo, Malinaw TRC, alam namin yan. Pero ako mismo, and if I ask them, do you know where it is? Do you know what we do? Akala nila, ano kami, psychiatric facility. Sabi ko, hindi po. Mukhang spaceship yung aming lote, pero humans po kami dealing with P-Woods and alcoholic addiction. So as far as the community is concerned, nandun po yung aming tawag dito, empowerment, capacity enhancement seminars, and advocacy in the schools. Our point person in advocacy, Mr. Nyolan Anyonuevo is also here with us. Please stand up, Nyo. And previously, ang kinekater lang niya ay mga high school. Sabi ko, alam mo nyo, kung high school lang i-cater lang natin, medyo late na yan. Ibaba mo sa elementary. And true enough, sabi niya, alam mo, doktora, tama yung sinabi mo. Kasi meron akong na-attendehan at sabi nga nila, as early as 8 and 9 years old. So, you know, actually, Dr. Atris, this is what we can do as far as capacitating and providing technical transfer. Meron din kaming mangyayari na treatment for children, no? Children of in families exposed to drugs. And ito po, initiative namin sa Malinaw TRC. We invited speakers from Manila and they are speakers from UNODC. They will be coming in December. To show you that we are not only looking at Malinaw, but because the LGUs are our partner in the community, hindi po lahat ng taga Malinaw makakasama doon sa training. We will be inviting 1 to 2 partners in the very active LGUs who are already in active partnership and already having MOA with MTRC. Huwag ho kayong mag-alala. If you need our help, we are just a call away. I already gave you our CP number, our email, and even our Facebook. We are always here, and we assure you that we will reply back, no? In terms of funding, nagagawan po yan ng paraan. Naandyan din po ang CHD na pwedeng sumuporta sa amin. And in terms of the school, na-encourage ako, sabi ko, buhay ang kabataan, buhay ang pag-asa ng bayan. Nilapitan ko po si Miss Cyril kanina, and I offered her my cell phone number, and I gave her my number to tell her that if you need resource persons and whatever it is you need, we are here in Malinaw TRC for you. So that is our commitment from Malinaw TRC.
Thank you so much, Dr. Tris. Before I proceed, let me personally congratulate our alumna. I was actually amazed with her presentation. I am not personally aware that Cyrene is very good, very conversant on the advocacies where they are at present. Now, with the, I would like to take Doctors, your words as suggestion. Maybe we lack coordination with the local government unit, telling them that we have existing program about the school mental health support and services. Yeah, we really need their support. However, with the downloading of so many duties because of the, ano ba yung sinasabi natin sa local government unit? Basta all or some of the functions of the government agencies was already downloaded to the local government unit. So Malilipot is a very small town, fourth class municipality with only very minimal national tax allocation, more than 41 million only. And that is why if they are going to attend to all the needs of the schools, say for example, 18 elementary school and 5 secondary schools in the municipality of Malilipot, they cannot actually accommodate our needs. So maybe, Doctors, we will double time. At first, I do not have that idea that being into this particular program, I will personally feel the urgency that we have to make sure that this is functional. We are doing this not for simply requirements purposes, but we need to do this wholeheartedly, and by all means, by our own connection, we will try to sustain the school mental health support services of San Jose National High School. Thank you.
Thank you, Sir Buen. And a while ago, during your presentation, Sir Buen also mentioned about the research that you are doing now, so that, di ba, nagdo-document, you have the data, and now that will help in justifying, no, kung may call for support, ito yung needs kasi, based sa nauna ninyong intervention. So that's also one step.
Yes, that's true, Abby. And I also remember Doc Gail Gomez kaninang umaga, no, she was saying how difficult it is really for local government units to push para magkaroon ng isang localized mental health policy. So we understand the frustration din, no, Sir, when minsan kapag mahirap makakuha ng local government support, not because they don't want to, but because sometimes mahirap talaga hanapan ng allocations. This actually led me to an insight because Senator Gatchalian actually filed Senate Bill 2200, which is actually already in its third reading, which is called the School-Based Mental Health Well-Being Promotions Act. So nakakatuwa isipin kasi yung mga provisions na ginagawa ng program ni Mr. Buen sa school niya ay nandun kasama sa draft na House Senate Bill na mayroong center, mayroong mag-a-address ng mga professionals. So this is a very, very welcoming idea na napakaganda rin isipin na wala pa nga yung batas, meron ng ginagawa ang mga
It's from the ground.
Yes.
No? So hindi na lang ito, ano yung sasabi natin, top down.
Yes,
Ito
galing
na,
sa baba.
galing sa baba at sabi nyo nga, mapupulutan na ng best practice.
Yes. And I think Ma'am Wendy also has something to add.
Actually, kinapture ko yung sinabi kanina. That was a very good sharing. Especially when she mentioned about what do you need? Yung kailangan. Because we already identified a lot of people who would like to help the mental health. Malinaw po yan. Marami po tayong mga gustong tumulong na iangat yung ating mental health sa ating community. But this is the reality. There's a lot of restriction. As you mentioned, kailangan nyo ng support. So with that support, we need to identify sino po yung dapat na magsusupport. Sino yung minandahan na dapat lagyan ng mental health program ang isang community. So I think ito yung dapat natin tingnan dyan. And I would like again to direct that our National Mental Health Act, malinaw po dyan kung sino yung dapat na mag-umpisa to initiate so that we can extend this opportunity to support the need of our service users. So I think this is also one of the call for action again to our LGUs and the role of each one of us, especially from the NGAs, the DOH, no, the DSWD, the DepEd will need to convene pag-usapan po natin. But it has to be initiated by the LGU. So malinaw po yan. So kung hindi po pinag-uusapan, I think there's someone who should lobby that. And marami po tayong opportunity to lobby that. And I think with that, malinaw po kung sino po yung dapat na mag-umpisa. It takes one to start the mental health. But I would like to emphasize that each one of us has significant role to spark this issue so that we can extend the help to these very talented and very generous with a kind heart to help the mental health. So let's grab this opportunity because we already identified champion in our locality. No? So yan po yung apila. No? Meron tayong batas, malinaw po yan. Sino po yung dapat na mag-umpisa para kung ano yung kailangan ng isang service user, may bigay po natin yan. But I'm so happy. I think our LCs now are very clear with the direction. Kailangan lang po natin siguro i-remind lang because we understand all of us are very busy maybe. So iba yung priority. But with this conversation and discussion, we see the priority. And I think let's put that as one of our 8-point agenda. So yan po yung ano na.
Alright, thank you Ma'am Wendy. Gusto ko i-highlight yung sinabi mo na it takes one. Yes. Okay, ano Abby?
Yes.
Yes, sir.
We have another Miss T. Sige po, go ahead.
Yes, good afternoon, everyone. So my name is T. Aringo, and I'm from CBM Global Philippines, and one of the council members since then it started, no? So siguro this is not a question but an insight. Kasi through the years, no, I've been with the council when we started this program, and as a member of the NGO sector, before from a local NGO now to CBM Global. Siguro yung nakikita ko lang po, no, I really commend lahat ng speakers because nag-scale up na talaga ang ating service delivery network in the Bicol region and everybody deserves a round of applause. From all the presentations kaninang umaga hanggang sa hapon. And I think what really provokes me, no, while Abby were sitting at the NGO table, yung talaga, no, sabi ko, this is it. This is our dream from the sector that we need people with lived experience, the service users already the one in front of us saying what their needs are because we as stakeholders could be of help to them kung alam natin kung ano yung pangangailangan. And I think one of our mandates as an organization is strengthening the service users' voice. That's why we partner with the government, with the different stakeholders, the non-government organization, and even the other CSO to push this advocacy. So I would like also to congratulate Cyrene. Job well done, Iha. So napakaganda and yeah, being a mother, touched din talaga ako sa mga sinabi mo. Yeah. Very yeah, napakaganda. So siguro at this point, as I've been pushing in the council, this is now high time, no, to have representatives or extend the membership to the service users organization. And we do hope, like si Ma'am Wendy has been collaborating with us, asan na yung mga community-based organization, where are the support groups, and maybe with the local government units, the good practices that we have in our locality, it's high time na rin i-raise yung bar para magsabayan po tayo. Hindi lang yung mga professionals, who's talking about mental health, the other stakeholders, but sila mismo, the service users are persons with lived experience. So I hope this could be another agenda in the council, and we do hope that our stakeholders from the different provinces and the region would be able to help us in that pushing forward to have a representation at the council. Thank you very much.
Thank you, Ms. G. And actually, I was there during the first quarter council meeting, no? Alternate member na imbitahan through CBM Global. And Miss Wendy actually announced that already. Ano ma'am? Doon niyo po yun in-announce that the council is really open to anong tawag doon? Nomination po ba yon or endorsement para sa membership nga po no ng a representative from the organization of people with lived experiences. So this is again no another reminder to all of us na tayo pwede from this audience, Ma'am Wendy, na mag-endorse no ng kung sino na member. So sige po, Ma'am.
Actually, tama yun. Kasi we are now in the direction of strengthening especially protection of our service users. In fact, when I presented a while ago the ways forward, one of those actually is the establishment of the internal review board. So ano po yung papel no, ng ating mga internal review board? Kailangan po may composed of the CHR, DOH, and of course, representative from the service user organization. I think doon papasok yung ating, maybe the peer support from the youth or service users from any organization who have these life experiences because we want them to be part of our solution. You are the ones experiencing the need and expectation, and we want to offer you what you need. What we want now is to empower all the people with life experience to be part of this council. And in fact, this is the lucky, no? Hindi pa po fully, kumbaga, official yung ating IRP because ito yung gap natin. Wala pa po nominate na service user organization na mag-represent as part of the internal review board. I think this is an opportunity for you to voice. No? Ito yung platform for you to relay your issues and concern and relate because we believe you are the one more experienced when it comes to reviewing one of the concern when we talk about the human rights. Kaya yung team natin, mental health is a universal human rights because we want to cater, we want to offer inclusive services to all our persons, inclusive, including the service users. So sila po yung ating priority because we believe sila naman po talaga ang less privileged and less, neglected when it comes to
uh, human rights, no? May mga violations. And it's high time to translate that by engaging our service user organization. So this is an appeal, no? If you have this kind of service user organization, we would like to welcome you, but there are some requirements or criteria. Number one, you should be recognized by the DILG. Magpapacertify po kayo na kayo po ay isang organisasyon at meron po kayong ni-represent na isang grupo na magiging boses po ng isang service users na magiging member po ng internal review board. Because the direction for in 2024, ang ating pong i-audit lahat ng mga hospital. The tertiary, including our pilot, the BMC, no, Department of Psychiatry. In fact, they are also trained in our internal review board conducted by the WHO. And of course po, no, yung ating pong yung service users should also be trained on that. So they will be part of our audit team so that we can pursue our direction that all of our health service provider network are really observing, no, to provide in you or in human rights, no? Ganun. So, naka-align tayo. Thank you po.
Thank you, Ma'am Wendy. Do we have any more questions from our audience, from our participants? Sige, habang naghihintay. Ako may question ako para kay Dr. Giselle. Hello, Doc. Doc, kasi I'd like to congratulate you on your CBDR program. It's very, very needed sa oras na to. And I am sure that there are other local government units who are having difficulties in trying to establish their CBDR programs. Yung interventions niyo po ba for main CBDR ay ginawa ninyo or was it something that has been made at in-adapt ninyo?
We use the SUBI, the 23 sessions. It is a model na tinuro din sa amin noon ng Malinaw Chief of the Rehabilitation Center. And we added na lang dun yung sa mga code dependents like the family, to involve the family. And we integrate also mental health with that session.
And I'm sure I'm asking the question because part of the things that we can do with the CBDR is to evaluate the program in terms of effectiveness. Ano po? May data na po ba tayo in terms of how naging effective yung intervention so far?
So far, wala pa naman kaming studying kinandak, but based on our graduates and based on the social reintegration ng the community, and binigay na namin yung monitoring sa BADAC. So nakita namin na although may relapse, but little of that person. And nakita namin how they go along na dun sa mga hanap buhay, pagkakakitaan, na pwede na silang pagkatiwalaan. And yun nga, merong mga success stories naman. And hindi namin inaalis yung support ng community and then yung family. And we need help actually dun sa mag-organize ng support group sa community kasi mahirap na yun sa part namin. And we are open kung sino mang NGOs would like to partner with us to organize the community support. Kasi mahirap na po sa part namin.
Yes, so what have been the challenges so far? Tapos siguro last, ano ang maibibigay mong insights or advice for other organizations, agencies, or LGUs in enriching their CBDR programs? Kasi successful yun.
Una sa lahat, we started small steps and then inorganize, nagkaroon ng mga na-formulate yung aming mga executive order para ma-in place namin. Nag-assign ng mga focal person na dapat maging responsible and we choose committed person to do this. Kasi mahirap ka kahit professional ka but you're not committed and compassionate doing this, iiwanan mo yung program. Dahil sa maraming challenges and wala kang support. But good for us, Sorsogon City, na very supportive ang aming LC. Pag gumawa kami ng work and financial plan, nandun agad ang kanyang financial support through an executive order. And isa pang pinagmamalaki namin, yung aming local mental health law na na-harmonize namin lahat ng offices and agencies in the city doing mental health activity, we unify that and harmonize. Kaya lahat ng meron pinag-iisa namin, ay may budget ka sa ganito, let's do it. Meron kaming sa youth, okay, let's do it, sasakay kami dyan. Yung ganun po ba, para ma-maximize yung resources, not only us, dun sa financial resources. So ang advice ko is, find committed person to do this.
Thank you, Doc. Parang babalik din sa sinabi ni Ma'am Wendy kanina, no? Find that one person. Yes.
Salamat po. Meron pa ba from our audience would like to ask, no? Burning question, yung katulad ni Dr. Trisha, hindi makakatulog pag hindi natanong. Sige, ako naman may ika-clarify in partner communities, no, in the community mental health project we're having now sa Sorsogon, meron pong mga nababanggit, no, and across these two sites na kailangan nga po talaga ng the service user kapag kumbaga i-check in for inpatient, and yung na present niyo po, that's 18 to 60 years old. So, ang clarification at ang sinasabi nila, ma'am, hindi ba pwedeng walang ganun? Kasi yung pasyente, pero walang gustong sumama. So, parang nagiging barrier yon. Ano ang ibang accommodation po doon? Meron po kaya? First and foremost po, yung facility po namin is a hospital. So in any hospital, may bantay. Ano po? Nagkataon lang po talaga na yung aming service is mental health. Ano po? Kaya minsan, may iniiwan na lang na pasyente o sinasadya na ibaba ng bus doon sa tapat namin. Ano po? So, kaya napupunta sa amin. Ano po? So, dito na po papasok siguro yung good coordination with the social service, ano po, ng bawat LGU, para kung halimbawa may ganyan po na limitation, na ang nagpipirma po is the social service. Ano po? Or kung dinalaman po ng PNP, si PNP po yung pipirma doon sa consent. So bakit po necessary yon? Kasi pag umaling ang pasyente, alam po namin kung kanino ibabalik. Ano po? So ayaw na po kasi namin dagdagan, ano po, yung aming custodial care. 200 bed capacity lang po dapat kami, pero lumalampas po kami doon. So, talaga pong sinisigurado namin na dapat may bantay. So, otherwise, kung wala po, we let the social service and or the PNP na mag-sign doon para sila po yung contact person namin once mag-improve na yung patient. Ibabalik namin. Oo. Opo.
This is turning into a very interesting discussion. Ano, Abi? Makisali naman po kayo.
Ayan. So, may mga pumick up nun, Doktora, for sure. Sige po, so we know it's getting late, but we really we cannot skip this part, no? Pero if there are no more questions, and kung wala na rin from our, speakers, we can close this. Going once?
Ako na magtatanong ng going twice. Ayan, okay, so close. So again, we would like to take this opportunity to thank our resource persons for coming up front and then discussing all of these things. It's been a very productive discussion. Ayun nga, sabi ni Ma'am Wendy, it is a very good platform. Ito ay isa sa mga napakalaking simula para mas, sabi nga ni Doc Marla kanina, keep the fire burning in terms of mental health. So maraming salamat po sa ating participants then for participating in our discussion, panel discussion. And we'd like to give the floor now to our MCs to formally close.
Thank you so much.
Hello. May we ask all of our resource person to please stay on stage? And we also thank our moderators, Ms. Abigail Del Puerto and Dr. Jim Baloloy, for facilitating our open forum. As we conclude this enriching open forum session, I want to express our heartfelt appreciation to our esteemed speakers and moderators. Your insights, expertise, and dedication to this important dialogue have illuminated the discussion and enriched our collective understanding. Thank you for being an integral part of today's event. Your expertise and guidance have been instrumental in making this discussion a success. May we also ask for Dr. Monray Mancilia to aid us in awarding our very deserving resource persons for today.
And now to read the citation for the plaque of recognition. This is awarded to our resource speakers for their grateful recognition of their invaluable contribution and unwavering support to the implementation of the mental health program, and as resource person during the 9th BICOL Mental Health Congress at Legazpi City on October 25, 2023, duly signed by Dr. Ernie V. Vera, MPH CHA, SASO 3 Director 4. Again, thank you very much to our resource speaker. This plaque is awarded to Honorable Cielo Crisel Lagman Luistro, to be received by Ma'am Cristina Bonga. Same plaque of recognition is awarded to Dr. Jaisel Sabdao Calleja. To Dr. Edessa M. Parde Lagdao. A plaque of recognition is also awarded to Dr. Maria Estrella B. Tam. Same award is given to Mr. Buen Owog Owog. Same recognition is given to Ms. Irene May Dita. And also a recognition to Dr. Gibson A. Gabita.
May we ask all of the representatives for the booths po? May we also ask for you to please come to the stage so that you can also receive your plaques of appreciation. So, representatives po for the booths po, yung sa display.
City Health Office of Tobacco. Award nito. Legazpi City National High School, Camarines Sur Treatment and Rehabilitation Center, Juan M. Alberto Memorial District Hospital, Malinao Treatment and Rehabilitation Center.
Because you know I'm all about that.
Bicol Medical Center,
I'm all about that. No trouble. I'm all about that. No trouble.
City Health Office, Sorsogon,
But I can take it like I'm supposed to. I got that boom boom that on the board take. All right.
Bicol Medical Center,
Working that Photoshop. No, that shit ain't real. Come on, now make it stop. If you got beauty, beauty.
City Health Office, Sorsogon,
Perfect from the bottom to the top. Yeah, my mama, she don't make no worry.
Provincial Health Office, Camarines Norte,
Cause you know I'm all about that. No trouble. I'm all about that. No, I'm all about that. No trouble. I'm all about that.
A round of applause for our booths po. Very good. And of course, as we conclude our formal program, we want to encourage everyone to explore and engage further. You're always welcome to freely visit the booths and exhibits that have been set up outside. This is a fantastic opportunity to connect with organizations, gather more information, and discover resources related to mental health and well-being.
As we approach the culmination of this event, it is an honor to introduce the cluster head of the Non-Communicable Disease Prevention and Control Cluster to deliver the message of gratitude and concluding remarks. Let us all welcome Dr. Monray Isaiah Simancilia, MD, MD.
Mas marami nabanggit po sa Indoga Boss. Okay. So una po sa lahat, maraming salamat po sa lahat ng nag-stay until this very moment. Nagpapasalamat din po tayo sa kaninang mga maagang pumunta at syempre sa mga dumalo at nagbigay ng kanila pong oras para sa ating munting activity na ito. So let me end this activity with an end. Ano yun? We always have a shared vision. And ang vision po natin is something na pinipicture natin what we want in the future. Meron po tayong shared vision sa Pilipinas at tinawag po natin itong Ambition 2040. Gusto po natin by 2040, meron po tayong pinipaint na picture. Gusto natin i-paint yung picture ng life na gusto natin by then. Ano ang sinasabi ng Ambition 2040? Gusto natin ng matatag, panatag, at maginhawa na buhay. Ngunit itong ating pinaint na picture, hindi po ito mangyayari kung hindi po malusog, mahaba ang buhay ng bawat Pilipino. At napakalaki po ng kayang gawin ng health sector patungo po dito. Tayo po sa health sector, meron din po tayong sariling vision. Alam niyo po ba yun? Ito po ay gawing healthier ang mga Pilipino sa Asia. by 2040. Napakalaking pangarap, napaka-ambisyoso, pero definitely gagawa natin ng paraan dahil ayaw naman natin na yung iiwanan natin na next generation ay mga unhealthy. Nga lang ang definition natin ng health is a complete physical, mental, and social well-being and not merely the absence of or information. At dito po binibigyan natin ng diin at pagpapahalaga na hindi ibig sabihin na walang sakit, malusog. Kasi malaki ang component ng mental health po sa pag-determine kung talaga nga bang health ang isang tao. Nga lang, syempre sa mental health, napakalaki ulit yan na usapin. Ngunit sa usapin na to, again, masyado na tayong madaming nagawa. Listening from the different presentations, nagmamigraine ako, pero kumikit ako, pero na-absorb ko lahat ng mga minention po ninyo. At ang layo na pala ng ginawang implementation ng mental health and the details. Nakakatuwa. At syempre hindi siya pwedeng mangyari kung hindi po dahil sa inyo. Nga lang ang task po natin, of course, number 1, care for yourself. Napaka-dedicated natin ng mga tao, napaka-devoted natin, napaka-workaholic natin, pero wag na wag po natin kakalimutan to always take care of ourselves. Second is, wag po natin kalimutan din to take care of others. And taking care of others, being us health workers, kailangan po ibahagi po natin sa kanila kung ano man ang natutunan po natin patungkol sa mental health, patungkol sa kaalaman natin sa kalusugan, dahil ang ibang kababayan po natin hindi alam na. At kung hindi po nila alam yan, paano sila mabibigyan ng empowerment to decide for themselves na maging healthy din po. And tayo po, health workers tayo, pero I believe na ang health workers ay lahat ng Pilipino. Hindi lang po doktor, midwife, nurse, ang mga health workers, hindi lang allied field, kundi lahat po ng Pilipino. Dahil yung health, yung social health, yung interaction natin sa lahat ng nakakasalamuhan natin araw-araw is a great factor to determine kung yung binibigyan ba natin ng health ay, or pinakausap natin ay binibigyan ng health. Merong tanong sa akin kanina sa civil service activity. Doc, ano ang ginagawa ng Department of Health para makontrol yung mga health workers na hindi maganda ang treatment sa patient? Napakahirap ng tanong na yun. Napakahirap talagang sagutin yung tanong na yun. Kasi as healthcare workers, we are expected na hindi ka lang nagbibigay ng gamot, hindi ka lang nagsiswero, hindi ka lang pero even yung smallest detail ng pakikipag-usap mo, pagbibigay mo ng rapport, pag-show ng tamang care, that will impact kung talagang magiging healthy talaga yung patients natin, yung clients natin, etc. So I leave that as a challenge for us to reflect. Hindi rin po magiging healthy kung definitely hindi enabling yung set. Kahit healthy tayo, or behaviors natin are healthy, pero yung workplace natin ay hindi healthy, yung community natin ay hindi healthy, hindi rin po yan magiging healthy at hindi natin ma-reach yung ambition. Kaya ang habol po natin ngayon is dapat i-empower natin, isama po natin, kasabay po dapat sa iboboses natin na yung workplace natin ay maging healthy. Yung ating community maging healthy din. Otherwise, mahihirapan pa rin tayo na maging healthy ang lahat ng Pilipino by 2040. So today, let me give my gratitude to everyone who made this event successful. Let me start sa attendance ng ating mga local chief executives. We really appreciate the presence of course, our Honorable Mayor, Shelo Lagman Luistro, as well as Honorable Maria Esther Hamor. We also would want to thank our partner agencies, government agencies, our national non-government organization, the member of our Mental Health Council here in Bicol Region, our PHOs, PBOs, DMOs, the academe, the APUs, the hospitals, the representatives from the 6 provinces, the BHW, the media, yung mga nag-perform po sa atin ngayong araw. And of course, nandiyan din po, kung may nakalimutan po ako, pasensya na po. Nagpapasalamat din po ako sa lahat ng mga tumulong para maging successful ang event na to. Starting with our IT unit, ang aming general services, na nag-set up ng mga booth, nag-set up po ng ating pong mga LED. I would want to thank our family in HPC who covered the whole event and made na gawing live dito sa aming Facebook page to increase the reach of our Mental Health Congress. I would like to thank yung ating pong host, Ma'am Je, and of course, Mr. Jerome. Pasasalamatan ko din po ang ating pong mga booth exhibitors. Napakagaganda po ng mga booths po na sineta po natin. Ang dami pong interaction, may mga games, may mga speakers. Napakaganda po niya. And of course, hindi ko po pwedeng makalimutan ang aking family din po sa NCDP. Hindi natulog. Hindi natulog. Ang daming ginawa para lang mapangyari itong event na ito, para ma-experience po natin. Let me call them one by one para naman po ma-honor natin yung mga aking mga kapamilya. Ma'am She, Ma'am Ana, Ma'am Maisel, Ma'am Rain, Ma'am Oliver, Sir Oliver, Sir Mark, Sir Josh, Ma'am Lian, Ma'am Kay, Sir Lian from the PS as well. And of course, hindi ko po pwedeng makalimutan ang aming mentor, ang aming leader, at ang talagang advocate ng mental health. Not only in DOH Bicol, not only in Bicol Region, kahit sa buong Pilipinas. Of course, nandiyan si Ma'am Wen. Wendy, love na love ko yan si Ma'am Wen. And syempre, hindi ko po pwedeng kalimutan din yung ating mga nag-serve sa atin, ang ating pong caterers, the venue, everyone in this room. Maraming salamat po. So ngayon, I leave the challenge to each and everyone. Sana po, kaisa po namin kayo sa vision na gusto natin. Karamihan sa atin, baka retired na by 2040. Baka retireable na by 2040. Pero, meron ba? Sa 2040, ako, baka retired na po ako ng 2040. Pero, ngayon, right now, nasa atin po yung bola. And yung bola na yon, nasa atin din po yung desisyon. Gugustuhin ba natin maging healthy yung next generation? Or hahayaan natin na parehong problema ang kakaharap? Kasama po dapat natin ang kasarili natin sa pag-advokasya ng lahat patungkol sa kalusugan. Again, let us not keep the knowledge to ourselves. Let us increase the reach. Bigyan po natin ng karapatan or ng empowerment, ng tamang knowledge ng ating lahat ng mga Bicolano, lahat ng Pilipino sa tamang kaalaman, not only in mental health, but in all other health systems. Dahil deserve nila ang tamang kaalaman patungkol sa kalusugan, dahil lahat ng Pilipino dapat malusog. Ito ay para mapangyari ang ating healthy Pilipinas dream at para ma-achieve po natin ang ambisyon natin sa 2024. Maraming salamat po.
Thank you so much po, Dr. Mon. So, thank you very much. That was a very inspirational message, and hopefully, we take that with us as we go on and go back to our original places of assignment. However, before we end, we are delighted to present the messages of commitment through a video presentation. These messages are a testament to the dedication and support from our partners and stakeholders in our shared mission. Please stay tuned as we prepare to showcase these heartfelt and inspiring messages from those who are committed to making a difference in our cause. Ladies and gentlemen, our video messages.
Hello, welcome. I really want to thank the Department of Health for inviting me, for giving me this opportunity to attend.
Bicol 9th Mental Health Congress. I really learned a lot from the different speakers from all over the Philippines. So, ang saya, ang dami kong natutunan.
Ayan, another round of applause po. And of course, sa ating head ng mental health, si Ma'am Wendy, for all of the efforts along with our people.
Thank you very much, Department of Health, for inviting us as participants in this 9th Mental Health Congress. We've learned so much about mental health programs because we know that this is really a pressing and then alarming issues of our learners, especially in the school setting. So hanggang sa uulitin po next year. Thank you, DOH.
So first, I would like to thank our officials from the DOH for coming up with this activity. Please be assured that at least from Naga City, we are here to be in support of all your programs and endeavors. Kami rin po from Naga, we definitely need your help in serving the direction. So, mamumulit din po kami sa inyo. Thank you very much. Looking forward to working with you.
I am a doctor and I pledge to support the implementation of mental health program in the Bicol region.
Pledge to support mental health because I am an advocate, especially in the Department of Education.
I pledge to support the mental health program, especially that we are dealing with adolescents, with students, particularly at San Jose National High School. Thank you.
This is Mayor Crisel Lagman of Tabaco City, and I pledge to support mental health because there is no health without mental health.
It's our collective mission for enhanced mental health services. Let us take these inspiring pledges to heart and work together to turn them into reality. Thank you to all our partners and supporters for their unwavering commitment. And we are not alone on this journey, and together we can bring about meaningful change.
Also, before we end, we would like to remind all participants that to claim the certificate of appearance and a simple token of gratitude, you need to accomplish the customer satisfaction survey through the link presented on the screen. Yung link ko for client satisfaction. And upon completion, please present the generated QR code to our secretariat. Your feedback is highly valuable to us and we appreciate your time and input.
With that, we have come to an end of our role as your masters of ceremony for this event. It has been a true pleasure and honor to guide you through this program, and we hope you found it as enriching and insightful as we have.
We would like to extend our sincere thanks to all of you the speakers, organizers, and participants for making this event a success. Your presence and participation have made a significant difference. As we part ways, we wish you a safe journey home or a productive continuation of your day. Please stay connected and let's all continue to work together towards our shared goals. Once more, I am Jerome Columna,
I am Geraldine Gapayaw,
and it has been our distinct privilege to be your hosts to the 9th BICOL Mental Health Congress. We bid you all a wonderful afternoon. Thank you.
Woo!